Good morning, everyone. I would like to call the meeting of the Committee on Health and Human Service Policy to order. If we can please take our seats. So currently, we do not have a quorum, but we're going to begin with our first bill of the day. So if I can have Representative Olson. Okay.
Good morning, Madam Chair.
Good morning, welcome. We're going to begin with House File 3838, who's going to be co-presenting with Representative Baker.
Yes.
Welcome.
Good morning, Madam Chair and members. So Representative Baker and I will be tag teaming the bill here.
Can we have it
And
quiet in the
so
room?
this, for those of you that remember last year, House File 400 was the opioid response bill, which was quite a comprehensive piece of legislation, really nation-leading legislation. And so as we're here today, what we have in front of us is what we're calling our Fix-It bill. That obviously with a bill of that size, a lot is going really, really well with what happened in House File 400. But there are a couple of things that we do need to address that are a little bit more urgent. And so just to kind of put a finer point on it, that, the bill took many years of work, a lot of compromise. There are a lot of things that I'm sure people didn't love, but had to live with. So the goal of this bill isn't to address broad-ranging concerns or things that maybe people want, to have different. And we have a set of bills that are moving that are doing a bunch of different things around opioids. So what this bill is it's really three kind of categories of what we're looking at for fixes. So we have in this bill nonpartisan staff technical changes. So things that were brought forward that just, completely just, we'll walk through them, but that were completely nonpartisan staff technical changes. We have what DHS brought forward via the Advisory Council, because as part of the legislation, what we did was we created an opioid advisory council, which is overseeing the administration of the grants and working closely with DHS and making changes to that, which Representative Baker is a part of. And Representative Cagle also is on that. And so that is where changes get voted on. And so DHS brought forward a couple of things that the Advisory Council has already voted that needs to be changed. And so that's a part of this legislation. We also have a very narrow set of concerns that were raised by the Board of Pharmacy through Dr. Weiberg that also in the interim came to light that we needed to change. So those are kind of the three categories. We're again not looking to relitigate the whole bill or open it up for a bunch of changes, but really those categories, those three categories. And this is also something that we work closely with Senator Rosen on, who is the Senate author, and Senator Eaton, myself, Representative Baker, to agree that this is kind of the package of things we'll do within this bill. And so, again, the goal isn't to put forward a bunch of pieces of legislation around it, but to really narrowly address these set of concerns. So just to put it in context. And I'll explain the bill, but do you want to say a little bit more about that part, kind of what we're trying to do here?
Representative Baker.
I think, Madam Chair, I think Representative Olson did a nice job giving an overview of it. I think, again, this bill doesn't really cost anything different than what we've already set up. I think we've learned from there's some changes in the revenue, but which is a downward trend, but we fixed some things because we listened. And during the summer, we heard some comments and concerns about things, and I think we're here just to kind of address that. As a member of the advisory task force, I will tell you, you have 17 people that have been appointed that are working their tails off to get this right. We were supposed to be meeting on a quarterly basis. We're meeting every month. And our next meeting is coming up in about 2 weeks because we want to make sure we give a good comprehensive report to the legislature of where our work is at. I'm really proud to be the vice chair of that committee, and we're doing it to make sure that we don't miss something. We've been working on priorities and things that we're finding holes in our systems, but we're also breaking down silos of many communities around the state, many agencies around the state are doing good work, but they're not talking to each other. So we're finding what those are, and we're really opening up the door for that. So I'm looking forward to giving an update on that as well, but I'm just really proud that this group is meeting from 9 a.m. to 4 p.m. every month, and they are they're steadfast, and we're looking forward to getting some good reports to you out soon. So.
All right,
But
thank you, Madam Chair. Yes.
So you have testifiers?
Would it be helpful to walk through the bill first?
Yes,
and then we
please.
could go to testifiers. So within those categories of change, I'll walk through them in the order I mentioned them, the nonpartisan staff technical changes being first. So MMB, when we set up the special account that the opioid money, the money went in, our fee structure went in, and in the event of a settlement went into, we set up the account in the special revenue fund as a new fund in the state budget, and MMB has the authority to set up and maintain the state budget system, and they believe the administration of a fund in this instance provides for better accounting procedures and reporting. So the technical change that we need to do in this bill is change the word account to fund, which you'll see reflected in the bill. In the bill that was enacted in 2019, the base fees for the Board of Pharmacy were increased. When the revisor updated the statute, it did not combine the base fee and the new registration fee for opioid drug manufacturers. The result of this is that the Board of Pharmacy does not receive the base fee of $260 from the opioid drug manufacturers. The technical change needed is to set the fee for opioid drug manufacturers to $55,260. You'll see that change reflected in here. And for technical reasons, the account structure in House File 400 required the amounts for the Board of Pharmacy and the Commissioner of Public Safety be transferred. Now that MMB has set up a separate fund, these amounts should be directly appropriated from the fund. So you'll see that technical change in that piece as well. And then, so that kind of is the nonpartisan technical changes that were brought forward. The piece within the DHS things that were brought forward. These two changes were voted on by the Opioid Advisory Council that Representative Baker sits on that we need to change is we need to allow the Minnesota Hospital Association to appoint its representative to the Opioid Response Advisory Council. That was something we intended to do in the bill last year, is let them do that rather than DHS, and we missed that, so that changes that. And reducing the term lengths for council members from 4 to 3 years, which again was already voted unanimously on by the Advisory Council. So that's the changes within the DHS piece. And then going to the pieces from the Board of Pharmacy, we have Dr. Weiberg here who can answer more questions on this. But kind of two things within that we heard around prescribing. We've had a lot of conversation in the state and the nation around prescribing guidelines around opioids. We did some of that in last year's bill, with good result, but because of some of the unintended consequences around the 30-day script refill, which I'm sure some of you have heard, we're eliminating that section, knowing that the opioid prescribing work group is working on a lot of that, as are other folks, and that has agreement from stakeholders on that as well. And then the other change we're making in the bill was one brought forward by Dr. Weiberg as well, that is that when we did the fee structure, so House File 400, as it started in the House side, just had opioid manufacturers and distributors paying in the $20 million. When we compromised with the Senate fee structure, we raised fees across the board for folks, not just opioid manufacturers and distributors, that we brought in a whole different set of players. And in that, we captured some folks, the opioid the compressed gas, yes. Compressed gas distributors were caught in that a higher fee structure. And so it was brought to our attention by Dr. Weiberg that needed to be addressed. And you'll see that reflected. We changed the word distributors to dispensers, and we dropped the fee down to $276 for that group. And so those were the changes brought forward by the Board of Pharmacy. So that's the three categories of changes. Again, the scope being narrow. You'll probably hear testimony from people that would like a lot of other things changed. There's opportunities after, we also, I think amongst the authors have, let's also get through a year. And if we need to do changing, if we see the fund isn't where we need it to be, we may need to revisit fee structures. We may need to think differently, but we're not even a year in to this enactment. And so we don't want to go in with a knife and make a whole bunch of changes until we actually get to see it. So I imagine you'll hear testimony that there's a whole bunch of things that may need to change. And I would just encourage folks to work with myself and Representative Baker, and we can work on other pieces of legislation as we move forward too. So anything to that? Otherwise, we'll take questions and or testimony, however you'd like to do it, Madam Chair.
Well, thank you, Representative Olson and Baker. I just want to say thank you for your just diligent work around this issue that is impacting so many people's lives across the state of Minnesota, and your dedication to continue to get this right. It's a lot, you know, you created a work group to come together thinking quarterly would be okay, and you realize there's still so much work to do that you need to be monthly. And so I just want to thank that work group for coming together to do this work, to get us to a good place where we can move forward. So we do have a couple of testifiers here. Dr. Weiber, before we have testifiers, anything you want to add to the conversation?
Madam Chair, members of the committee, I'm Cody Weiberg. I'm the Executive Director of the Minnesota Board of Pharmacy. It might be good to do a little bit of an explanation about the medical gas piece. Some 20, 25 years ago, perhaps, the Board of Pharmacy was given the authority to regulate medical gases. And I wasn't with the board then, so for some reason I don't understand what we now call medical gas distributors got that name. Now, normally, when you talk about distributors, you're talking about wholesale distributors. But what we call today medical gas distributors are actually not wholesale distributors. We have a separate license for medical gas manufacturers and for medical gas wholesale distributors. But what we're calling distributors today are actually dispensers. When they register as the so-called distributor, all they can do is dispense oxygen directly to patients. The legislature last year, when it passed the opioid omnibus bill, decided to exclude pharmacies that dispense drugs directly to patients and don't manufacture or wholesale drugs from this larger fee. And so I think it's important, I think, to also exclude the medical gas dispensers. I can also tell you that starting as early as June of last year, we have 108 medical gas these distributors that actually dispense around the state and in a few outside the state. And I was contacted as early as June of last year from representatives of individual companies. A lot of them are small companies, not all of them. Some are associated with like the health systems, but a lot of them are smaller companies. And they quickly told me that if they had to pay that $5,260 fee, they would drop their registrations. The board obviously cannot change fees by statute, but the date on which renewals are due is set in rule. And so I was concerned enough, I thought we would lose as many as half of the dispensers in the state, and people might have to drive quite some distance to get a tank of oxygen, that I asked the board to grant a blanket variance to extend their registration renewal date from December last year to June 1st, specifically so the legislature could consider this issue. So I just want to talk a little bit more about that.
All right, thank you. So, welcome to the committee. Please introduce yourself for the record.
Thank you. Chair Moran, members of the committee. My name is Tim Kiefer. I'm an area vice president with Airgas Air Liquide, one of many members of the Compressed Gas Association, CGA, and the Gases and Welding Distributors Association, operating or bringing medical gases into Minnesota. For purposes of the bill here today, our Roseville, Minnesota location would be considered both a medical gas manufacturer and wholesaler under the current proposed definitions of the bill. Thank you for the opportunity to testify on HF 3838 on behalf of the Compressed Gas Association and Gas and Welding Distributors Association, which includes manufacturers, wholesalers, and distributors of medical gases such as oxygen, nitrogen, medical air, nitrous oxide. These gases are used every day by doctors, dentists, clinicians, first responders, and home care professionals to improve the lives of individuals from birth through end of life in settings such as hospitals, nursing facilities, dental facilities, and home care. As a consequence of the landmark 2019 opiate epidemic response law, manufacturers, wholesalers, and distributors of these gases face a nearly 3,000% increase in annual licensure and renewal fees. We are appreciative of Representative Olson's reduction of license fees for distributors of medical gases referred to now as dispensers in this legislation. We do, however, have some concerns with the bill. It is unclear what the definition of a medical gas dispenser is, and it would be difficult to determine who may or may not be included in this new category. This fee reduction would not impact our members' 68 sites holding 90 licenses under the various categories supplying medical gases in Minnesota that would still be responsible for this incredible fee increase. This may be a little confusing, so I'd like to make sure there is a good understanding of the business model around medical gas distribution. You may be able to imagine the challenges with storing and delivering medical gases. Medical gases are stored and delivered in high-pressure gases in metal cylinders or as very cold cryogenic liquids. This means that gases cannot be transported efficiently over long distances and can evaporate in relatively short periods of time. This means our industry must use many smaller operations as opposed to single large site operations in order to be close to the customer, whether that be a hospital, a clinic, emergency responder station, or home care delivery. We believe that consequences of lowering the licensing fee only on dispensers may not have the impact intended and will still leave the majority of the medical gas industry supply chain to suffer and need to adjust, potentially impacting dispensers either through higher pricing, holding higher inventory levels, or having to travel longer distances to source medical products. This also would put greater strain on medical gas supply and result in reduced reliability for other segments of the medical community, including hospitals, dentists, and first responders. This, of course, is ultimately of worse consequence to Minnesotans who rely on oxygen to maintain their lifestyles. We thank Representative Olson for hearing our concerns, and we look forward to working together to move forward. Thank you to the committee for the opportunity to share our concerns, and I'm happy to answer any questions.
All right. Thank you so much. We're going to hold the questions until after the last testifier, Kevin Falconer.
Good morning. Thank you, Chair Moran and members of the committee for allowing us to come here and testify today. My name is Kevin Falconer. And I'm not here today as part of Big Pharma or a contributor to the opioid epidemic in any way, which this bill is drafted to address. But rather, I'm a third-generation president and future owner of Minneapolis Oxygen Company. We're a family-owned, independent medical and industrial gas distributor and have been doing business in Minnesota since 1946. We serve Minnesota customers through our locations in Minneapolis, Shakopee, Ham Lake, Hibbing, and Duluth. As this bill is currently written, our medical license fees for these 5 locations would increase from around $1,000 per year to over $37,000 per year, because at 2 of these locations, we would both be considered a manufacturer and a distributor. My fear is that the end users will be negatively affected by this bill as the way it's currently written. For example, a small vet clinic in Chisago will see severely increased prices, increased complexity for distribution of these gases to small dental clinics and doctors' offices in areas like Grand Marais and Hibbing. Companies like ours will be forced to consider totally removing ourselves from this market and thus limiting the choices for end users for supply. I'd stress that in every one of these scenarios, users will see dramatically increased prices, especially in rural areas, as these are the hardest areas for us to supply. Thank you for the opportunity to explain the impact of this bill, not only on my company, but at all industrial and medical distributors in Minnesota, as well as the end users we serve. I'd strongly urge you to revise these fees for manufacturers, wholesalers, and distributors of medical gases to the dispenser level. Thank you.
Thank you so much for your testimony. Is there anyone in the audience who would like to testify? Okay, well, let's open it up for questions. Representative Alderson.
Thank you, Madam Chair. Representative Olson, why were the medical gas companies included in this original bill?
Representative Olson.
Madam Chair and members, so again, I'll just remind folks that followed along last year on House File 400, when it originated on the House side and which passed off the floor, we only had opioid manufacturers and opioid distributors paying into the fees, the $20 million annual fee structure. The Senate side had a different model for fee structures, and due to the compromise, we opened up the fee structures for not just opioid manufacturers and distributors, which was the House position. We ended up having to take kind of a holistic approach to who paid into the $20 million, which brought in a whole set of fees on a variety of folks, which you see probably in looking at the legislation. And so as you're hearing today, it brought in a whole different set of actors to pay into this at different fee structures. So not everybody pays as much as the opioid manufacturers and distributors do. Their fee structure is a lot higher. But it did raise the fees on everybody because a lot of fees hadn't been raised in a very long time, and the Board of Farm, Dr. Weiberg can talk about that. So that was kind of the, I guess, philosophical reason this happened, and then just how the compromise happened. So it brought in a wider variety. And then Dr. Weiberg can speak more specifically to fee structures too.
Dr. Weiberg.
Madam Chair, members of the committee, so two things did happen last year. The board, as part of its own budget bill, asked for a fee increase, and one of the things that we wanted to do was to have the same fee across all businesses that we license, because they varied from as little as 110 to 235. And so our proposal was to bring everything up to 260. And as Representative Olson has mentioned, I worked on the opioid bill for 3 years, and up until the beginning of last session, it was all on opioid manufacturers. And then it did get broadened last year. And so I was given the task by legislators in both bodies to come up with a fiscal note that would generate $20 million, and that would exclude pharmacies. And so that necessitated raising a fee up to $5,000, or adding an additional $5,000 fee on most of the businesses that we license, except the pharmacies. And then there was a desire to have the medical manufacturers pay even more, so their licensing fee went up to $55,000.
Representative Edison.
Madam Chair, thank you. Representative Olson, I have great concern about raising the fees on manufacturers of gases. Minnesotans need air. I mean, I support your changes. I do have concerns on that one piece.
Representative Olson, you good? Representative Albright.
Thank you, Madam Chair. To the testifier, Mr. Falconer, are you typically involved in legislation?
Mr. Olson, what is it?
No.
Okay. Falconer. Representative Albright.
Thank you, Madam Chair. Mr. Falconer, would it be fair to say that you're typically more involved with regulatory environment surrounding the gases that you dispense and provide for the medical community?
Mr. Falconer.
Yes.
Representative Albright.
Thank you, Madam Chair. Mr. Weiberg? Was the gas community at the table when you set their fee schedule?
Dr. Weiberg.
Madam Chair, Representative Albright, we don't set the fee schedule. The legislature sets the fee schedule.
Representative Albright.
Like I mentioned, we did request that our fees increase. We have to come to the legislature about every 4 or 5 years because of inflation. Our proposal was to raise for the medical gas manufacturers and distributors, I think the fee increase would have been about $35 a year. That's what we proposed. But the legislature has to dispose of what we propose.
Madam Chair.
Representative Albright?
It seems a bit ironic that in light of the need to fill a hole, we included some folks that weren't even at the table, which is very, very concerning to me, particularly when they are now having to foot the bill. I look at the page 3 for the bill itself, and the only entity that I see that isn't relevant to the opioid industry are the medical gas industry, which I find troubling. And Mr. Weiberg, whether you say you don't set the fee schedule or not, you propose it. And unfortunately, you were tasked with coming up with how to put that $20 million together. And I find it somewhat troubling that we're filling the hole on the back of folks that are in the regulatory environment versus the industrial in the legislation. I also share Representative Edelson's concerns that this could have a dramatic effect on people that are providing gases not only to hospitals and clinics, but also to inpatient and in-home care, when all they're looking for is oxygen or air to get through the night and make sure that they wake up in the morning. But if you're looking at reducing their number by possibly 30% or 40% just because you've got to fill a hole in your proposal, I don't see how that's good legislation. I think that's very troubling when you're just basically figuring out how you can come up with the money from somewhere. I don't think that the amendment that I have seen goes far enough. And Representative Olson and Representative Baker, if you're still in the room, I would move with great speed to correct this injustice.
All right. Representative Olson?
Sure, Madam Chair. And just to comment on how much just making this change here to the distributors to the dispensers. So reminder, we're not raising any fees in this bill. This bill, that's not what this is. It's making the change to decrease fees on dispensers. That alone will be a $500,000 annual decrease in the amount of money going in. So it's a significant amount of relief we're providing to some of the folks that you've heard testify. It doesn't hit all of it, but it's a big chunk. And again, I would just remind folks that last year when we were putting this legislation together, these concerns were not raised in any of our committee stops along the way, and when we had open negotiations with the Senate in setting these fee structures. What I did hear was a lot of pushback from some of the folks raising concerns today that we're not willing to support a bill that just had opioid manufacturers and distributors as the only people paying in. So it's a narrow fix right now, and if we want to revisit the fee structures, I think we should do that, and we should continue that conversation. And I think the point, that Dr. Weiberg is making is this is a list, these gas distributors that will now be called dispensers, and he can share. I have a list that's like 3 pages long who will be getting some relief through what we're trying to do right now.
All right. Representative Albright?
Madam Chair, to either Mr. Kiefer or Mr. Falconer, do any of the medical gases that you produce, dispense, wholesale, carry in your truck, I don't care how it gets there, are any of those related to the opioid situation?
Mr. Falcon? Okay. Excuse me one moment, please. Can you go to the testifier table?
They are
And
not.
please reintroduce yourself again, just for the record, so we can know who's speaking.
Tim
Please,
Kiefer.
can we give him a seat? Yeah. Thank you.
Thank you. Sorry.
Thank you, please.
Thank you. My name is Tim Kiefer.
Thank you.
The answer, in response to your question, no. None of the products that we produce, dispense, deliver, distribute are related to the opioid category. And if I may,
Yes, you may.
The supply chain related to medical gases, although we identify dispensers and call them out here, it's interrelated. So by increasing the fees at the manufacturer distributor level, those will flow down to those dispensers and ultimately to the consumer. It's just a function of the industry and the supply chain. It's all interconnected. So my opinion, carving out one piece, it doesn't address the concern that's being raised.
Madam Chair, I think
Representative
the
Albright.
purpose for the question is to prove the point that it's an unrelated industry, but they're being caught in the net, if you will, to fill the hole that was created. Whether you voted for the bill or not, I think we're including people that are unrelated to the emphasis for this bill in making sure that it's paid for.
Yeah, and I just want to remind members that this bill will be going to HHS Finance. You can have that discussion in that committee. So we have a quorum present. So I would like to make a motion to approve the minutes for February the 26th. Members? Okay, Representative Pinto moved the minutes for February the 26th. All in favor, say aye. Aye. All opposed? The motion has been moved and the minutes approved. Okay, is there any further discussion on this bill? Dr. Weiberg?
Madam Chair, members of the committee, again, I've had to provide technical assistance on opioid bills for about 3 years. And so this is in the form of more technical assistance, just to make some clarifications. So the Board of Pharmacy licenses several thousand different facilities, several thousand different businesses. And the point I think I need to make is it is definitely true that medical gas manufacturers, wholesale distributors, and what will now be called dispensers if this bill passes, don't dispense opiates. They don't directly contribute to the problem. But the reality is that the vast majority of the manufacturers and wholesalers that we license also don't handle opiates either. And it was a legislative decision, a compromise, as I understand. I'm not involved in the politics that go on here, but it was a legislative decision to include a broad range of businesses. And I sat through hearings with testimonies, saying that certain legislators that had liquor licenses paid more for their liquor licenses than the businesses that the board licenses. And it really is a legislative decision of the governor as to what to do with the fees. But what I can tell you is that if the legislature were at some point to decide to reduce the fees of all the businesses that do not handle opiates, the hit would be in the many millions of dollars of decreased revenues.
Well, thank you for that information.
And one more clarification. I think I need to talk to the gentleman after the hearing here. There seems to be some misconception. Mr. Falconer only needs one license. If he's got manufacturing licenses, he needs one license per facility because a manufacturer can manufacture, distribute, and dispense. A wholesaler can wholesale and dispense. So no facility ever should have more than one license. So that doesn't affect the license for each facility, but it may reduce the total number of licenses that they need, and that may give them a little bit of relief.
That's good information. Representative Baker?
Madam Chair and Committee, as well, I think when you work on a bill like this, we heard right away that gases were an issue, and I think, again, Dr. Weiberg has addressed a lot of things. We do think there's still a lot of confusion out there with manufacturers, dispensers, wholesalers. We need to make sure that there was never an intent from a license fee to go from $1,000 to $37,000. No. But they're part of the medical world. And we have to understand that part of the medical world that they provide important gases to is not meant to ever eliminate or make it hard to get or expensive. The idea was to do this broadly so that this is shared by many. And I think we are committed, Representative Olson and I are committed to make sure that this next step is going to be an important one, but we want to make sure that we have more of a conversation with our friends in the medical gas community so we better understand what their needs are and exactly how how their business models are laid out, so we do not over-license and over-tax if you want to use that, but we want to make sure we get it right. So we do have another stop, and this is what we're doing here today, and we're committed to doing that.
Okay. Representative Keel.
Thank you, Madam Chair. So Dr. Weiberg, did I understand you correctly that we are going to make sure that someone who only needs oxygen is going to be paying part of this? So we're going to raise the cost of nursing homes, patients. We're going to, because that's in effect what's going to happen, is, do I understand that correctly, that we are going to bring the costs across the board and we are going to make everyone pay more for oxygen that they absolutely have to have?
So, Dr. Weiber, I'm going to allow you to respond to that, but all the other finance pieces, we're going to hear that in Health and Human Service Finance, and don't stick to the policy piece of this. But go ahead and.
Madam Chair, Representative Keel, certainly when I provided technical assistance, even when the original bill involved only opiate manufacturers and wholesalers, there was a discussion brought up by myself and by legislators of acknowledging the fact that no matter who paid the extra fees, they were going to pass those on ultimately to consumers. And so again, for the first 2 years, this was only going to be opiate manufacturers. That would have meant potentially the cost of opiates going up. The legislature decided to broaden it out, and there was a discussion about this, about those costs potentially being passed on to consumers.
Representative Keel.
Thank you, Madam Chair. So then, this conversation, I'm assuming, will continue. I too am very, very concerned about what this means for our residents, not only those who can access it, but Grand Marais is even not as far north as I live. And to be able to access oxygen, and this, my other mindset is going to be, my facilities are getting oxygen from North Dakota. Is this going to cause a problem for them? And will we have more trouble getting oxygen? So there's also that thought process, and I will look forward to Health and Human Services Finance to have this continued discussion. So, and maybe we'll need to talk offline about what's going on. Thank you.
Okay, well, thank you. So there being no further discussion, the chair moves House File 3838 to be recommended for re-referral to the Committee on Government Operations. Okay, all in favor say aye. Aye. All opposed? The motion prevails and House File 3838 is recommended for re-referral to the Committee on Government Operations. Okay. So members, thank you, Representative Olson. So members, we have another bill that needs a corrective referral, which is House File 3678, and should have been referred to the Early Childhood Division. There's a copy of the bill in your folders for your reference, but the chair would like to move that House File 3678 be re-referred to the Early Childhood Finance and Policy Division without recommendations. Are there any questions on the motion? Seeing none, all in favor signify by saying aye. Aye. All opposed? The motion prevails and House File 3678 is re-referred to the Early Childhood Finance and Policy Division without recommendations. Okay, Representative Olson, where is she? Okay. So why don't we go to House File 3322, Representative Kunesh-Podein. Okay, the chair moves that House File 3322 be recommended for re-referral to the Health and Human Service Finance Division. Representative Kunesh-Podein, please present your bill.
Oh, good morning, and thank you, Madam Chair. So this bill concerns breast and cervical cancer screening. Under the current law, medical assistants provide services to persons with breast or cervical cancer who have been screened by the Minnesota Breast and Cervical Cancer Control Program. Then another program referred to as SAGE receives funding for breast and cervical cancer screening and diagnosis from the Federal Center for Disease Control and Prevention. The bill that I am presenting here to you today will allow medical assistance coverage to also be provided to persons diagnosed with breast or cervical cancer by any CDC-funded breast and cervical cancer control program in the state, and is not limited to just medical assistant coverage to just persons that are diagnosed with SAGE. A little bit of information around breast cancer and cervical cancer as it pertains to our Native American population. In 2002, it is estimated that 4,670 women in Minnesota will be diagnosed with breast cancer, and 630 of them will die from the disease. Finding breast cancer at an early stage increases the opportunity for effective treatment and for patient survival. And our uninsured or underinsured women have lower screen rates for mammograms, which result in greater risk of being diagnosed at a later, more advanced stage of disease. In 2020, it is estimated that 104 women in Minnesota will be diagnosed with cervical cancer, and American Indian women are twice as likely to develop cervical cancer compared to white women. And so right now there is a program in place called the SAGE Screening Program that is funded jointly by the state and the CDC's National Breast and Cervical Cancer Early Detection Program. And it provides breast and cervical cancer screenings to women who meet really specific eligibility requirements. The American Indian Cancer Foundation is working hard to get more urban American Indian women screened for breast and cervical cancer. Screen Our Circle is a CDC, NBCCDEP funded program to provide breast and cervical cancer screening to urban American Indian women. This program has the very same eligibility requirements as the SAGE Screen program. So, Screen Our Circle removes the barriers to cancer screening, and then it provides support to our urban clinics and performs community education and outreach activity. Our women of color and American Indian women are screened at lower rates in Minnesota, and what we would like to do with this bill is to reduce the barriers that block access to breast cancer screening and treatment, and like insurance status, medical costs, and language barriers. And so I ask for your support in ensuring that our American Indian women and women of color have better access to federal funds that will prevent, will do early screening and prevent catastrophic illness in the future.
Okay. Thank you, Representative Kunesh-Podein. So before the testifiers speak, I just want to remind or just state to the members in the audience that we have a long agenda today. So I'm asking the bill authors and the testifiers to be brief. And we're going to try to move as quickly as we can out of respect for everyone to have their bills heard today. We've been authorized to meet in this room until 12 noon. And we can also go past 12 if need to be. But we're going to try to end on 12. So, to the testifiers, please welcome and introduce yourself.
Thank you, Madam Chair. Madam Chair and members of the committee, my name is Emily Myatt. I'm the Government Relations Director for the American Cancer Society Cancer Action Network, the nonprofit, nonpartisan advocacy affiliate of the American Cancer Society. I'm here today to testify in support of House File 3322, legislation to expand access to breast and cervical cancer treatment for any woman diagnosed with cancer through a CDC National Breast and Cervical Cancer Early Detection Program. I want to thank Representative Kunesh-Podein for her leadership on this issue. We know many barriers exist to preventative care and cancer screenings, and that's why the CDC has funded states and tribal organizations to screen low-income, underinsured, and uninsured women. And federal law says that any woman diagnosed through this CDC program is automatically eligible for Medicaid for her treatment. The bill before you today focuses on making sure women diagnosed through existing screening programs, both funded by the CDC, have access to the cancer treatment they need. Many of these women would already be eligible for Medicaid, but we want to make sure that no woman falls through the gap. What good is a mammogram or cervical cancer screening if once you're diagnosed, you don't have access to the chemotherapy or radiation you need to survive the disease? By supporting this bill, you're making sure our state law conforms with federal law and that all women diagnosed through a CDC breast and cervical cancer program has access to the treatment she needs. You've received a letter of support on the issue that includes the support from more than 20 organizations, including the Masonic Cancer Center, Mayo Clinic, the Minnesota Association of Community Health Centers, the Minnesota Medical Association, and the Minnesota Hospital Association. The Minnesota Chippewa Tribe has also passed a resolution in support of this bill. Thank you.
Thank you. Welcome to the committee. Please introduce yourself and continue with your testimony.
Madam Chair and members of the committee, good morning. My name is Melissa Buffalo. I'm an enrolled member of the Meskwaki Nation in Iowa. I'm also the Deputy Director at the American Indian Cancer Foundation. The American Indian
Closer
Cancer
to your
Foundation.
mic. Could you speak
Oh,
up or
sorry.
closer? Thank you.
My name is Melissa Buffalo, an enrolled member of the Meskwaki Nation in Iowa. I am the Deputy Director at the American Indian Cancer Foundation. The foundation is a national nonprofit established to address the tremendous cancer inequities faced by American Indian Alaska Native communities. We are based out of Minneapolis. I'm here today to testify in support of HF's 3322, legislation to remove barriers to treatment for women diagnosed with breast or cervical cancer. The foundation is ACAF for short, receives federal funds from CDC's National Breast and Cervical Cancer Early Detection Program to do targeted breast and cervical cancer screening for urban American Indian women. Screen Our Circle is a program in Minneapolis working with the Native American Community Clinic in South Minneapolis to get more women screened for cancer. As you heard, American Indian women are less likely to be screened for cancer and are more likely to be diagnosed at a later stage. Prevention is the best way to treat cancer. Screen Our Circle serves between 5 to 8 women a month. However, the way statute is stated means that if a woman is diagnosed through the program, she wouldn't automatically be eligible for treatment, even though federal law says she should be. The women could go to the SAGE screening program, but we want to remove as many barriers as preventative cancer screenings as we can, and Screen Our Circle meets women where they are. Please help us make sure the women diagnosed through Screen Our Circle can access the care they need to live. Thank you.
Thank you. Is there anyone else in the audience who would like to testify? Okay. Being none, let's go to Representative Pearson.
Thank you, Madam Chair. And I guess, you know, when you look at the editing of the bill, it's pretty basic, but I just want to make sure I'm tracking exactly what's being said here. The bill says that currently anyone who's in a Minnesota breast and cervical cancer control program would qualify for medical assistance. And that doesn't sound like, based on the previous testifier, that doesn't sound like that's exactly the case, even though the statute, as I'm reading it, just says it that way. So can you just walk me through why it doesn't conform to the federal guidelines, then?
Ms. Myatt?
Madam Chair, Representative Pearson, current law implies that only women diagnosed through the SAGE screening program, the Minnesota screening program, would be eligible for Medicaid for treatment, but there's other CDC-funded programs in the state like Screen Our Circle. So because it's written pretty narrowly, it implies that a woman diagnosed with cancer through the SAGE program, through the Screen Our Circle program wouldn't have access to the same treatment pathway.
Madam
Representative
Chair.
Pearson.
Yeah, thank you. And I wanted a clarity on that just because I just wanted to, again, circle back around to my original question, which is, by changing this language, are there any other Minnesota breast and cervical cancer control programs that we're now excluding that won't be covered? Because when you look at the editing, that looks like what we're doing, and I just want clarity that we're not omitting anyone that we should still be including.
Ms. Myatt?
Madam Chair, Representative Pearson, this actually broadens to any CDC-funded program, which includes the SAGE program, Screen Our Circle, or any potential CDC-funded programs that might come into this state. So we're not excluding any current programs.
Representative Pearson.
And I could probably take this offline as well, but, so that's all falling then within the definitions of the CDC and the MBCC EDP programs that we're talking about. Those current programs are all within those definitions. If that's a yes answer, then that's all I need to know.
All right. Seeing no other, Ms. Wyatt?
Madam Chair, Representative Pearson, that's correct.
Well, seeing no other further discussion, let me just say I am a huge champion of prevention. So anytime we're creating opportunities and possibilities to prevent something from happening, I think that's a great pathway to put some priorities. So thank you for your work. So there being no further discussion, the chair renews her motion that House File 3322 be recommended for re-referral to the Health and Human Service Finance Division. All in favor, say aye.
Aye.
All opposed? The motion prevails, and House File 3322 is recommended for a re-referral to the Health and Human Service Finance Division.
Thank you.
Thank you.
So Representative Olson? All right. So the chair moves that House File 2772 be recommended for placement on the general register. Representative Olson, we have an author's amendment in our folders. So the chair will move A-2, author's amendment. All in favor, say aye.
Aye.
All opposed? The motion prevails. Representative Olson, please present your bill.
Thank you, Madam Chair and members. This bill is in really addressing a workforce shortage need that we have around long-term care in our state that I think we're all aware of in this committee. And this bill modifies the Home and Based Community Service Employee Scholarship Program to allow participating home and community-based services providers to use the program to repay qualified educational loans of their employees. And with that, I'll turn it over to my testifiers. So, Chair Vereen, let's go first.
Well, welcome to the committee. Please, to the next testifier, introduce yourself and proceed with your testimony.
Good morning, Madam Chair. My name is Nicole Matson, and I'm with Care Providers of Minnesota, and here today with the Long-Term Care Imperative as well. I'd like to thank Representative Olson for carrying this important bill, and I want to give some background on the program, and then I'll turn it over to Libby from Leading Age, who will explain the importance of House File 2772 to our long-term care workforce recruitment, retention, and development. The Home and Community-Based Services Employee Scholarship Grant is a competitive grant for licensed home cares, assisted livings, or adult day programs that primarily serve people over the age of 65. Eligible organizations can apply through an RFP process managed by the Minnesota Department of Health each year. Organizations who apply then establish criteria by which the funds are dispersed for employee scholarships and training expenditures in courses of study that are expected to lead to a career advancement within the long-term care field. The total amount of funds available for fiscal year 2020 was $1.45 million and an expected number of 30 grant awards. Libby?
All right, thank you. Welcome to the committee. Please introduce yourself for the record.
Madam Chair and members, my name is Libby Chaprin. I'm with Leading Age Minnesota. Many of you know, as of this month, Minnesota has more seniors than school-aged children. 60,000 Minnesotans will turn 65 every year from now, well, earlier, from 2015 to 2030. This inevitably means we need more professional caregivers. The United States Department of Health and Human Services estimates that nearly 70% of people who are over 65 will need long-term services and support. The projected percentage increase in the number of positions employed in long-term care between 2010 and 2030 is staggering. 88% increase in home health aides and PCAs, 68% increase in nursing assistants, 93% increase in community and social service workers, and a 70 and 73% increase for RNs and LPNs respectively. Even today, home and community-based service providers are struggling with rising unemployment and high turnover rates. House File 2772 is just one tool to help address the current workforce shortage and better prepare Minnesota for our aging population.
Madam
thank
Chair, and
you.
I failed to mention that this bill does not have a fiscal note because it has no cost to it. Even though we're in policy, it's worth noting.
That's always good. Is there anyone else in the audience who wishes to testify on House File 2772? Members, any questions? Representative Keel.
Thank you, Madam Chair. Can you, and I don't know, Representative Olson, if you know this, right now, the Loan Forgiveness Scholarship Program, is it being fully used?
Madam Chair, I'll let my testifiers speak to that.
Please introduce yourself for the
Yeah.
record.
Madam Chair, members, I'm Libby Chaperon with Leading Age Minnesota. It's not, as I understand it, it's not being fully utilized today, and that's largely because of the restriction just allowing for the scholarship at this point in time. This bill would expand the use of this pool of money, this $1.45 million, to allow for loan forgiveness and also the training that will be required with assisted living licensure coming online in 2021. Our members will be required to have a licensed assisted living director. The training required for that will also be covered or allowable if this bill progresses.
Representative Keel.
Thank you, Madam Chair. And so my other concern would be is how is that being distributed, probably for the next conversation, but making sure that it is distributed throughout the state rather than in one particular area, because I think we are going to have a higher demand, obviously, because we need more employees to begin with, and then the new requirements are going to put a bigger demand. So, thank you.
Thank you. Chair Liebling.
Thank you, Madam Chair, and I just, I wonder if the way the bill is structured actually helps achieve the goal of increasing the workforce, because if I'm understanding this right, please correct me if I'm not, but if you're expanding the use of these funds to pay for, to help with loan forgiveness instead of training going forward, you're essentially using it to compete for existing employees who already have gotten that training. It would be one thing, I think, if the state was going to say, let's forgive the loans of everyone who goes into this field. But if we have limited funds and we're doing grants to employers to be able to use this money, it just seems to me we're just letting you compete with each other, letting the different employers compete for employees, because obviously competition for this small workforce is fierce. I'm not sure, though, that it really achieves the goal of helping the state increase the workforce generally. So could somebody speak to that, please?
Ms. Chaperon?
Madam Chair, Representative Liebling, currently the nursing home side of healthcare has the ability to do loan forgiveness, and home and community-based service providers do not. So there's a competitive advantage in the skilled nursing side that home and community-based service providers do not have. And I will note that we're all essentially competing for the same person, especially in the healthcare workforce.
Chair Liebling.
Thank you, Madam Chair, and I think that is kind of, thank you for that. That kind of makes the point, I think, that this doesn't necessarily increase our workforce overall. It is an issue about competitive, who's able to offer what benefits. And, not that I'm not downplaying the significance of that issue and problem either, but it does kind of point out how, probably we need more resources overall for this, and not everybody. I mean, we see a lot of proposals asking to have new categories of providers being able to tap the loan forgiveness funds, and that pool of funds doesn't really grow very much, as I recall. So anyway, I think it's important for us to keep in mind this isn't necessarily growing our workforce. It's just, putting different people in a more competitive position to attract that workforce.
All right. Any further discussion? So the chair renews her motion that House File 2772, as amended, be recommended for placement on the general register. All in favor say aye.
Aye.
All opposed? The motion prevails, and House File 2772, as amended, is recommended for placement on the general register. Thank you. So let's go to House File 2971, Representative Cantrell. All right, the chair moves that House File 2971 be recommended for re-referral to the Committee on Labor. Representative Cantrell, we have an author's amendment in our folders. So the chair moves the DE1 author's amendment. All in favor, say aye. Aye. All opposed? The motion prevails. Representative Cantrell, please present your bill.
Thank you, Madam Chair, members of the committee. It's a pleasure to join you today. Thank you for giving me the opportunity to present House File 2971. This bill is aimed at building capacity in Minnesota's service infrastructure to help improve competitive and integrated employment outcomes for people with disabilities in the state of Minnesota. To do so, this bill directs the Departments of Education, DHS, and DEED to build on current collaborative efforts in 3 ways. The first way is that the bill directs the creation of a plan to improve competitive integrated employment outcomes for transition age youth, beginning at the age of 14, when many youth with disabilities and their families are beginning to take a look at what is going to come after high school and what are their lives going to look like in the community. And it is a critical time for ensuring that there's a structured plan in place so that all people have a, I think, consistent path forward to being able to transition into adulthood and to be able to live in our community in an integrated way. The second the second item that this bill addresses is that it directs the respective departments in consultation with stakeholders across the entire kind of array of folks who are involved in helping to determine our policy around inclusive and competitive integrated employment and other integrated options outside of traditional employment for people with disabilities, to come together to develop the plan that we've discussed to ensure that it is consistent with the reality and the varied experiences of people who have been and will be affected by any policymaking that is performed in this area. And then one of the most important parts, and something that is lacking now, is that the bill requires the submission of a report along with various data points across various states that have both phased out what can be known as the 14C waiver subminimum wage, as well as mandates a report after a period of time to assess the success with which folks with disabilities have been able to access integrated employment at a minimum or higher wage to ensure that we are making progress in this area of law and this area of what I view as civil rights in our society, of ensuring that everyone who wants to and is willing to work has that opportunity and is able to thrive. So I'm not sure if this is included in the packet, but more than 15 advocacy organizations and service providers from across the state of Minnesota support this bill. And with that, Madam Chair and Committee, I ask for your support to make sure that every Minnesotan is able to thrive and is able to access the full breadth of opportunities in our society afforded to everybody else. And I'd like to thank a couple of members of the committee for signing on to this bill. Representative Freiberg and Representative New, thank you. I appreciate your support. And with that, I'll turn it over to my testifier, Madam Chair.
Thank you, Representative Cantrell. So welcome to the committee. Please introduce yourself for the record and proceed.
Madam Chair, members, my name is John Alexander. I am a board member of the ARC Minnesota, co-president of the Minnesota APSE, the Association of People Supporting Employment First, and in my day job, the CEO of Kaposia. Thank you for the opportunity to testify in support of House File 2971 today. Kaposia provides customized employment and retirement services to more than 300 people with disabilities as they build and advance their careers. At Kaposia, we partner with businesses of all sizes by helping them address workforce shortages, hire quality employees, build a more inclusive workforce, and ultimately be more profitable. We do this by matching and tailoring jobs that maximize the unique skills, interests, and abilities of the people we support that fit the needs of the businesses. Every day, people with disabilities demonstrate their abilities in the workforce and make livable wages that foster their independence. Unfortunately, not all individuals with disabilities, especially those with more significant support needs, people who live in greater Minnesota, people of color, have access to these tailored services that help achieve competitive integrated employment, as our current service infrastructure does not have the capacity to meet the demand. That's why we must build on current collaborative efforts between state agencies to expand access to and create incentives for these employment services. It's imperative that diverse stakeholders, including people with disabilities, their families, service providers, lead agencies, and business leaders, are at the table in this process. We have insights and capacity to lend innovative and creative ideas that will help move the system forward. Kaposia, Minnesota APSI, the ARC Minnesota, and many other advocacy organizations and service providers who support this bill are ready to work with the departments and leaders in the legislature, such as yourselves, to get this done. We must raise the expectations of and for people with disabilities, promote their informed decision-making, shift understanding of what's possible in their careers, and leverage their talents to contribute to Minnesota's workforce and economy. I'm joined today by Eric and his father. Eric is a self-advocate who can speak directly to the importance of House File 2971 by sharing his lived experience with building a career that he enjoys with help from job coaching supports.
Thank you so much. Good morning. Eric, introduce yourself for the record and proceed with your testimony.
Hello, please be a little patient. I am using an augmentative device to communicate with you. My name is Eric Marshall. I am 27 years old. I enjoy sports of all kinds. I like to cheer on all Minnesota teams. I like spending time with family and friends. I enjoy traveling as often as I can. I thought it would be easy to find a job. It is not so easy, and you really have to be persistent. I have also found that it can be hard to find a business to work with my schedule since I have such a busy life. Since I graduated, I have been busy. I found Ashland Productions Theater in Ark Valley Village as volunteer opportunities to build vocational skills while looking for paid jobs. I am now working at TCF Bank Stadium for Minnesota Gopher football games, and I work at the Marcus Movie Theater. I leverage many different job support services. Some are local supports from fellow employees, and other times I work with job coaches to assist me in more challenging aspects of my work life. Transportation can be a big issue for many disabled people. I use metro mobility when I can to get to work. It is important to work. I really like to earn money, interact with people, and give back to my community. It makes me feel proud to provide for my needs. Although it was a challenge to work with all the different agencies and providers to get a job, I was able to work through it. We visited over 100 businesses and approached the movie theater 7 different times before they were willing to take a chance on me. Fortunately for me, I have successfully found employment. I am sharing my story to help make sure other people with disabilities can find success as well. Don't be afraid. Get out there and go for it. It may take some time, but it is worth it. Thank you.
Well, thank you, Eric. I really enjoyed your spirit, and you'll want to go for it. So thank you. So is there anyone else in the audience who would like to testify on House File 2971? Members, any questions? Representative Albright?
Thank you, Madam Chair. More of a technical nature for Representative Cantrell, but I noticed a few just, changes with regard to the DE from the bill originally, with special notation to a couple of sections, and I'm just wondering if you could elaborate on them. I note that on page 2, you expand on points number 1 and number 2 under restructure and rebalance funding, as well as build capacity for increased demand. I'm just wondering what precipitated that change in the DE?
Representative Cantrell.
Thank you, Madam Chair, and thank you, Representative Albright. I only heard kind of the latter half of what you said. I apologize.
No, and let me just, in the original bill, as opposed to the DE, you've expanded some of the points with regard to restructuring and rebalance the funding, as well as building capacity for increased demand. And I'm just wondering, one, what precipitated that, and I'm just wondering if you could elaborate in terms of what your vision for those two sections would be.
Representative Cantrell.
Thank you, Madam Chair, and thank you, Representative Albright. So the changes that were made in the DE1 amendment were made in consultation with stakeholders, and based on their suggestions, we chose to change those sections. That's pretty much the feedback I have for you.
Representative Albright.
Thank you, Madam Chair. Representative Cantrell, under reports on page 3, I do know a significant change between the original and the amendment where you're going from data regarding individuals and going to summary. I'm just wanting to know if, from a data privacy perspective, is that disaggregated data, or what type of data are you looking to collect and for what purposes?
Representative Cantrell.
Madam Chair, Representative Albright, we're looking to collect data that will help us to actually measure so that we can improve the quality of our integrated deployment approaches in the state of Minnesota. And as you and I now serve on judiciary together, I'm sure that we may have the opportunity to discuss that in greater length in the future.
Representative Albright.
Thank you, Madam Chair. This is an exhaustive approach. I don't diminish the import, but this is an enormous undertaking, and I'm just wondering, you have already identified you're pushing out the effective date for the reports from 2020 to into August of 21. Is that in total that you're hoping to provide a report, or is it in some form or a section of this? Rolling it out in pieces, this is just an enormous undertaking as I look at it. And I'm just wondering if we aren't not setting up for failure, but setting up for confusion based upon everything that you're looking to accomplish in this bill.
Representative Cantrell.
Madam Chair, Representative Albright, I do appreciate the concern, and I don't disagree that it is an enormous undertaking. But I would like to iterate that this has been constructed with the input of involved stakeholders, and if they feel they're up to the task, then I think it's our responsibility to push ourselves, despite the enormity of the undertaking, to ensure that the folks with disabilities aren't being left behind in our society. But I do appreciate the concern.
Chair Liebling.
Thank you, Madam Chair. And first of all, I think this is a great effort and opportunity. And, there is a lot of, struggle, I would say, in the disability world between, what we, I guess, call the sheltered workshop approach, and then can people be in competitive employment? And, I think there's a real need to help people with disabilities expand their greatest and do work at the top of their game. And I really appreciate the young man here giving us his story on that. I especially like the idea that we're starting, this is for ages 14 to 24. I recently had a visit from someone in the disability community who was talking to me about the fact that young people with disabilities really don't hear about what options they may have when they're young. And one of the factors of having a disability may just be that you need a longer preparation period to be able to get out into the world and have that competitive employment. So I think that's good. I would even say we should probably even go younger to help people understand that they have potential and to start to really develop toward being able to be in a competitive employment situation. So I really like this idea and approach quite a bit. I'm not sure, it does say that the agency's commissioner shall develop and implement a plan. So I'm kind of, is this going to finance? It will be going to finance. Okay, because, obviously, developing is one thing, and implementing the plan, we need to think about what kind of resources that's going to take. But we just heard from folks about workforce shortages. And this is a refrain that we are hearing in every single sector. So there should be, it's an opportunity to get more people with disabilities into the workforce and have them have more fulfilling and have the pride of being able to support themselves and give back and all the things that Eric, right? All the things that he talked about. So thank you for bringing this, Representative Cantrell.
Thank you, Chair Liebling.
Representative Olson.
Thank you, Madam Chair. Representative Cantrell. Thank you for bringing this bill. My family, we're big supporters of Gigi's Playhouse, working with persons with Down syndrome. And at one of our fundraisers, a young woman who's 18 that has Down syndrome said, "Don't limit me." And that just made me think of this right now. So Eric, thank you for your testimony. Thank you for your optimism. You're advocating for so many. So I know there's many organizations that are working to, Mr. Alexander, it sounds like your organization's one of them. Will there be partnerships with DHS, with these organizations to help empower them? And then also, will there be more than one report? Because I think in 2021 there's a report, but is there going to be one to make sure that we're having accountability? And that, a lot of businesses are trying to do this, but I do remember hearing like a year ago that they're not meeting the standards that they set. Mm-hmm. So I just want to see more accountability on it.
Mm-hmm. Representative Cantrell.
Madam Chair, Representative Edelson, thank you for your question. If I understand the first part of your question correctly, you're asking if the stakeholders in these organizations are going to work together with the departments, with the commissioners, and that is correct. Yep, absolutely, because we believe that we do need an all-hands-on-deck approach to including, which means everybody, which means it means employers, it means folks with disabilities, it means making sure everybody has a seat at the table so that we can have the most comprehensive and well thought out plan moving forward. And then your second question is, will there be multiple reports? And so in consultation with stakeholders, this is something that we're discussing. It's an ongoing conversation about subsequent reports, and I think that there is likely an appetite for that, and so that is definitely something that's on the table, I think.
Thank you. Representative Keough.
Thank you, Madam Chair. I wondered, I've got a group in my county called DAC, Disabled. We always call it DAC, an activity center. There we go. D Activity Center. So, and they provide jobs for people and work within whatever their abilities are. And I'm just wondering, are they a part of this process, or is that entirely different from? I know they have people go to work, and there was some concern about funding and not being able to continue their grouping that they do up and down the valley.
Representative Cantrell.
Thank you, Madam Chair. Representative Keel, I don't mean to sound glib. I've not been in touch with that exact facility in your district. But rest assured that there is broad kind of consensus support for this among the industry. I believe that you described a day program of sorts in your community. So we do have folks like RISE who are on board with this. We have folks who provide these services who are at the table. So I think that you can, in good confidence, go back to the facility, what do you say, the DAC?
Day Activities Center.
DAC, yeah, the Day Activity Center, and tell them in good faith that, hey, we're trying to have a comprehensive, well-thought-out approach. And if they themselves want to come to the table, I'm sure that is amenable.
Representative Keel?
Thank you, Madam Chair. Yeah, I'll do some checking. I believe there were some concerns. So, and we're going to hear this in finance, right? Health and Human Services Finance. So I'll do some checking.
Okay, so there being no further discussion, the chair renews her motion that House File 2971 as amended be recommended for re-referral to the Committee on Labor. All in favor say aye.
Aye.
All opposed? The motion prevails and House File 2971 as amended is recommended for re-referral to the Committee on Labor. Thank you. Okay, Representative Klevorn, House File 2044. So the chair moves that House File 2044 be recommended for placement on the general register. Representative Klevorn, we have an author's amendment in our folder. So the chair would move the DE-1 author's amendment. All in favor, say aye.
Aye.
All opposed? The motion prevails. Representative Klevorn, please present your bill.
Good morning, Madam Chair and members. For the record, I am State Representative Jenny Klevorn, and I want to thank you for hearing our bill this morning. This is a technical change regarding certified birth and death records that are issued by the State Registrar at the Department of Health and by local issuance offices. This bill modifies the persons who may obtain an individual's certified birth or death record. The goal of this bill is to protect certified birth and death records and limit the potential for identity theft. My testifier is here to address the need for the changes and to address any of your concerns. Thank you, Madam Chair.
Thank you. Welcome to the committee. Please introduce yourself for the record and proceed.
Thanks, Madam Chair. My name is Molly Crawford. I'm the State Registrar of the Office of Vital Records with the Minnesota Department of Health. I'm here today to talk about this bill to help tighten security, reduce risk, and remove confusing language for our constituents. The bill modifies eligibility, as the representative said, so that legal birth and death certificates get into the hands of only those who need them and who are eligible to get them. We are asking or proposing to strike language for the party responsible for filing the record. These are individuals who work in hospitals who register births, the birth clerk. They could be funeral staff in a funeral director office or a funeral home. They collect data from individuals and they register that data directly into our vital records system. They are responsible for filing the vital records. Those individuals have no business need to obtain legal certifications under the existing clause.
All right, thank you. Is there anyone else in the audience who would like to testify on House File 2044? Any discussion from committee members?
Sure.
Representative Albright.
Thank you, Madam Chair. And Representative Klevorn, and/or to the testifier, I know that in my time in the legislature, there has been an ongoing concern about privacy, particularly with regard to adoptees, as well as to foster parenting, that type of thing. And I note on the back page, you are inserting language that says representing the subject of the vital record or another person listed in Clause 1. And I turn it to the front, and it says, under line 1.12, a child of the subject. So does this necessarily modify the accessibility of a birth record by a child for their birth parent that the birth parent might not prefer that to occur?
Madam Chair, I would ask that my testifier address this as the person who would know more about the issue. Thank you.
Ms. Crawford.
Thanks, Madam Chair. I'm happy to answer that question. The part of Statute 144.225 that we're discussing is about public records. You're asking about what we call replaced or sealed records.
Okay.
And so, no, it would not affect the ability to get at the sealed original record before an adoption.
Thank you, Madam Chair.
For there being no further discussion, the chair renews her motion that House File 2044 as amended be recommended for placement on the general register. All in favor say aye.
Aye.
All opposed? The motion prevailed and House File 2044 as amended is recommended for placement on the general register. Thank you.
Thank you, Madam Chair. Thank you, members.
Thank you.
Okay, House File 3445, which Representative Albright will be presenting in place of Representative Morrison. So Representative Albright, you are presenting this bill on behalf of Representative Morrison, as you are a co-author. I understand there's an A2 author's amendment. Would you like to move the bill? and
Madam
the
Chair, I'd
amendment?
like to move House File 3445 to the general register.
All in favor, say aye. Nope, not yet, okay. Okay,
Madam Chair, I'd also like to move the A2 amendment.
thank you. Yes, please. So on the motion of the A2 author's amendment, all in favor, say aye.
Aye.
All opposed? The motion prevails. Representative Albright, please present your bill.
Thank you, Madam Chair. And on behalf of Representative Morrison and myself, I'm happy to provide information. I have a testifier with me with regard to House File 3445. I will just summarize in brief. Section 1 is amended to streamline the eligibility review, gives the department an authority to monitor the number of children in need of this level of care. Section 2, Subdivision 1 establishes a per facility per diem to allow for specialization in service delivery as new PRTFs are established in the state of Minnesota. And Section 2 also includes language that conforms to the state plan amendment by permitting facilities or licensed professionals to the bill for arranged services. At this juncture, Madam Chair, I would like to refer to my testifier for any questions pertinent to the bill.
Welcome to the committee. Introduce yourself for the record and proceed.
Madam Chair, members of the committee, my name is Kirsten Anderson. I'm with Aspire Minnesota. We have the privilege to represent the psychiatric residential treatment facility providers in the state of Minnesota. And as Representative Albright reflected, this is truly a cleanup bill, and I'm here simply for questions.
Okay. Is there anyone else in the audience who would like to testify for 3445? Members, any questions? Chair Liebling.
Thank you, Madam Chair. I'm just wondering, this is going to the general register, and I just would, as I'm looking at it here, I just would like some explanation of why this is not expected to have any fiscal impact.
Ms. Anderson, please.
Madam Chair, Representative Liebling, that is understanding that we've gained in conversation with the Department of Human Services that this should have no fiscal impact.
Chair Liebling, would you like to hear from the department?
Yeah, if somebody's here who can address that issue, I would. This is a little bit complicated, so I think it would be good for us to understand that.
Madam Chair, Just as a point, it's very difficult to hear members around the committee at the testifiers table. So
Pardon me?
My point is made.
Okay.
And vice versa.
Welcome to the committee. Please introduce yourself for the record.
Madam Chair, Matt Burdick with the Department of Human Services. To your question, Representative Liebling, the point that I think you're probably looking at in the bill that is drawing your attention is the move to the per facility per diem. Currently, these rates are set based on an average of cost from each of the facilities. And so those, when we move from that average, it's already made up of those component pieces. We're just sort of disaggregating that and moving towards a per facility rate. But the overall pool of funding is not changing.
Thank you. That's very helpful. It's very helpful.
Thank you.
Thank you. Any further discussion? Great. There being no further discussion, Representative Albright renews his motion that House File 3445, as amended, be recommended for placement on the general register. All in favor say aye.
Aye.
All opposed? The motion prevails, and House File 3545 is on its way to the general register. Thank you.
Thank you, Madam Chair.
Okay, so we're going to have Representative Huot come up. Representative Kresha is in another committee, and as soon as he comes in, we will proceed with this bill. So right now, we're on House File 2179. Representative Huot, would you like to move your bill and then proceed with your presentation?
Madam Chair, I move that House File 2179 be recommended for placement on the general register.
Proceed.
Madam Chair, this bill just simplifies and brings in, basically in compliance with the FTC regulations on urn and casket sales for the state of Minnesota. We already are allowing others outside funeral homes to do this, and as we see many more cultures enter into Minnesota, we're seeing the need for people that, i.e. in the Asian community, we're seeing people want to build their own caskets. We're seeing people want to carve their own urns. And we can already do that, but this just brings it into compliance with the FTC. And with me today is Megan Forbes from the Institute of Justice to explain a little bit more.
Welcome to the committee. Please introduce yourself for the record and proceed.
Thank you. Good morning, Madam Chair and members of the committee. My name is Megan Forbes. I'm an attorney at the Institute for Justice. We're a nonprofit public interest law firm that works to protect civil liberties, including economic liberty. This is a technical bill. Minnesota law is ambiguous regarding whether a funeral director's license is required to sell caskets or urns, or whether consumers can make their own. MDH interprets this ambiguity to allow consumers to buy caskets or urns from any provider, including a funeral home, casket store, buying club, or over the internet. MDH also allows consumers to make their own caskets and urns. This bill codifies MDH's position. We support House File 2179 because it makes the law clear and understandable for both consumers and people who want to work in this area. This is especially important for consumers making end-of-life decisions. I'd lastly like to add that the bill was discussed at MDH's Mortuary Science Ad Hoc Policy Committee, and there was no opposition. Thank you for the opportunity to testify today. I'm happy to answer any questions the committee may have.
All right, thank you. Is there anyone in the audience who would like to testify in this bill? Okay, let's open it up for discussion with members. Any questions for members? Seeing none, Representative Huot renews his motion that House File 2179 be recommended for placement on the general register. All in favor say aye.
Aye.
All opposed? The motion prevails, and House File 2179 is recommended for placement on the general register. Thank you. Okay, so we're going to move on to House File, my bill, House File 771. Going to have Representative Keel come and grab the gavel.
Yep. Chair Moran, when you're ready.
Yes, give me 1 second.
Mm-hmm.
I believe I left my, okay. So, Madam Chair, I move that House File 771 be recommended for re-referral to the Committee on Government Operation. And I would like to also move the DE1 Authors Amendment.
Okay. Chair Moran moves that the E1 Authors Amendment. All in favor, say aye.
Aye.
Opposed? Okay. Motion prevails. Chair Moran.
Thank you.
Go ahead.
So, members, just like to give you some background information on the Cultural and Ethnic Community Leadership Council. Was the chief author of this bill back in, I believe, 15-16 legislative session. And at that time, as we're working and dealing with health disparities. So the council was created to really bring a voice from communities of color from across the state of Minnesota to be in partnership and advise the Commissioner on Health and Human Service around the disparities that was impacting communities. Specifically, at that time, was for communities of color across the state of Minnesota. And the bill had a sunset on it. So one thing it does is remove the sunset because the work of the council is not done. There's still work that needs to be done in relationship and partnership with community members and other stakeholders from across the state of Minnesota. So a little summary of what the bill does. It makes several clarifying changes to the Cultural and Ethnic Community Leadership Council. Some of those changes is allowing the chairs and ranking minority members on the council to choose a designee, requiring a Commissioner of Human Services to accept council's recommendations when appointing a chair, allowing for multiple chairs, modifying when appointing terms in, requiring the Commissioner to actively engage with the council, modifying language to ensure that there's equitable and cultural responsive models of program implementation, requiring the department to advise on progress and accountability measures for addressing inequities, and adding more duties for the commissioner, including reviewing and implementing equity policies with action plans and resources for implementation, supporting interagency collaboration for increased equity, addressing the council at least twice per year, and supporting members' participation in the council. It adds council's duty to advance legislative proposals to improve racial and health equity outcomes with community input, modifying council's legislative reporting requirements. It specified that council members may not be absent from meetings more than 3 times per year. It adds council members' duty to participate in work groups. It removes, again, the expiration date of June 30th, 2020. And it provides compensation under Minnesota statute 15.059 subdivision 3. So that is a quick summary of what the bill does. And I have a testifier who would like to speak.
Welcome to the, would you like your testifier to speak?
Yes,
Yeah,
please.
Okay. Welcome to the committee, and will you identify yourself for the record?
Yes, Madam Chair, members, thank you. I'm Reverend Dr. Jean Lee. I founded Children's Hope International, which is legislation and legal advocacy. I also are in our family centers, which was Minnesota's first Asian shelter and services with transitional and permanent housing. And also we do healthcare and social services. I also had the APAC, which is a housing consortium, which includes all the Asian organizations doing social services. I first want to thank Representative Moran, Chief Author, and Senator Hayden, and the co-authors, and the legislators who have attended some of the meetings, like Representative Tyser, who had the vision. Our authors had the vision in helping communities, children, families, and seniors, disabled, and others with DHS and other services. And since its inception in 2013, the commissioners, deputy commissioners, assistant commissioners, and other staff in human services have been supportive of the council, and we want to thank them too. The council was created to be a community-led liaison in providing their cultural communities equity, parity, and removing barriers and services provided by DHS, and including county human services, and being a mechanism for ensuring transparency and accountability of human services. Also, there's a need to strengthen equity and diversity and inclusion within the community departments and the services for children, families, seniors, disabled, and others, and address the community needs. So we asked, since a number of us are volunteers, we see this as very important to our communities, and we ask that you move the bill forward so we can get a lot of the work done. So thank you.
Thank you, Dr. Lee. And another testifier, let's see, is it Maria?
Sarabia.
Sarabia, okay, thank you. Go ahead and identify yourself for the record. And
Thank you. My name is Maria Sarabia. I serve as the chair for the Cultural and Ethnic Community Leadership Council, and I'm here to testify, asking the committee to sponsor our House File 771 for the Cultural and Ethnic Community Leadership Council. And I'd like to also further explain that while the purpose of the council is to provide guidance to the commissioner for the Department of Human Services, and the reason for this is that we know that Minnesota is home and presents to be a very thriving state for many, but for many others, particularly for families and people who are from culturally and ethnically diverse communities, we present with more challenges and more barriers than other communities. And so these disparities are across and present throughout the Department of Human Services through the programs and services. The charge of the council is, again, to advise the commissioner. Our strength for the council is really rooted in lived experiences, professional knowledge, and our rich history. In terms of our diversity and the growth that has taken place over the years since its inception. We aim to reduce race-based disparate outcomes through deconstructing barriers and working in partnership with the agency. We seek to work in true partnership and increase efficiency and effectiveness. Again, as Representative Moran has already stated, there's some policy changes, but it's really to advance the accountability and the partnership of working with the council. So we're asking for your support and approval for House File 771. I would also just add, from a personal perspective, I've made Minnesota my home, and the work of the council impacts me and my community. I have a 6-year-old and a 3-year-old, and my children are set to graduate from high school in 2031 and 2034. That sounds very far away, but it's really not that far. And so this work has a sense of urgency and a personal commitment to it. And we're here to represent that work and push for accountability in partnership with the legislature, the agency, and the communities that we represent. Thank you.
thank you. Is there anyone else in the audience that wishes to testify on House File 771? Okay. Thank you. Will you please identify yourself for the record?
Yes, Madam Chair, members of the committee. My name is Vajong Moore, and I'm the Director of Health Equity Advocacy for Blue Cross and Blue Shield of Minnesota. As the largest state insurer in the state, we want to take a comprehensive upstream approach to advancing health equity. If you look at the scope of work that DHS has, it covers virtually every determinant of health, from mental health, direct healthcare access, food security, you name it. It is a vital agency that will advance or hinder health and racial equity. It's been my pride and joy to be the former chair of this council for 5 years. I just want to lift up the significance of this leadership by Representative Moran and Senator Hayden and the authors. Her background in this was very humble. And I just want to lift up the significance that this is a structural equity approach to a structural inequity in Minnesota. So it's matching a solution with a problem that is cross-cutting in education, in health, in transportation, you name it. So I just want to make sure that what is fully understood about this approach and what this amendment is doing is going at a root cause of health and racial inequities. It is centering communities of color, indigenous communities, and communities that experience inequities into key decision-making processes at DHS. She mentioned this in the amendment, but I wanted to actually draw your attention to the expiration date, because it's bold and significant language that is saying addressing inequities is mission critical and a moral imperative for the state and needs to be standard for the state. So I strongly support this amendment, and I hope you join us in that. Thank you.
Thank you. Is there anyone else that would like to testify in the audience? Okay. Members, Chair Liebling, did you want to speak?
Yeah, thank you, Madam Chair. And so I'm glad you mentioned the expiration. I noted that. And, you know, I think the council is extremely valuable, and I appreciate the legislation, and there are many changes in here that I think are just great. But this one I flagged because the one about the expiration, I mean, it's a great, the intention of it is wonderful, but when you put language in law, you know, I think what you're essentially doing, unfortunately, is just removing the sunset. Because, I mean, let me just ask, who gets to determine when racial and ethnic-based disparities no longer exist? How do we know? How do we? I mean, you know, I think that's a wonderful. You know, this is something that we're gonna need to keep working until that happens. But putting that language into law as an expiration date, I don't know. That's a little difficult. Can you just talk about that a little bit?
Chair Moran, or?
Chair Liebling, I think it is aspirational, right? Really making a statement about where we need to go as a state, right? Because these disparities, whether it's health disparity or education disparity or work disparities, they are real, they are impacting real people's lives and stopping them from moving forward. And so, you know, we would know disparities exist when the research tell us that people are progressing. There's better health outcomes. There's better opportunities. We would know because there's research and data that informs us of where we are as a state. And so it is not a traditional type of, statement. But again, it comes from a cultural and ethnic community leadership council that is bringing their perspective into this conversation about where we need to be going as a state, so.
Okay. Ms. Sarabia, did I say that right?
Chair, yes, thank you. Representative, I would also add, while this council has been in existence for about 6 years now, in the construct of an organization growing, socializing, and normalizing this concept, we have grown significantly. We have infrastructure and we have staff that are in place now that can really lead the agency and be an example for all executive branches of state government. I would further add, because we've gone through those growing pains, we are now in a place where we have to push for accountability. We have the data, we have the benchmarks, and we can strive and really account for where we're making changes and also be more focused in priority areas. Some of the proposals that we've heard here today, rooted in breast cancer, rooted in foster care, rooted in mental health issues. These are all pressing DHS issues, but we know that if we look further in the data, if you look at communities of color and American Indians, the disproportionality for the health outcomes are really stark. And so we feel like we're in a place where we can really drive this work forward, and we have the leadership and the support to really, to make that happen.
Madam Chair.
Chair Liebling.
Thank you. Thank you for that, and I agree wholeheartedly with what you just said. And actually, as I'm sitting here, thank you for the discussion, Representative Moran. It is really unusual language. I think maybe the real answer to who will determine this is that it would take an affirmative act of the legislature to say, yes, we have, these disparities no longer exist, right? And so that would be quite a thing to have that happen. So, you know, I think what it's, and believe me, I am completely in support of at least extending the sunset, because clearly we have to do that, because, you know, right now in the bill, in the statute, it expires this year on June 30th, and clearly we don't want to do that. So I think I've become convinced that even though that language is really unusual, that it's appropriate in this case, because the legislature would have to come in and say, we don't think there are any more disparities. And that would be quite a thing to have that happen. So this probably is pretty appropriate and really interesting to do in this case. So, so I don't know, whoever on the council came up with that, pretty good work there.
Thank you.
Thank you. Representative Albright.
Thank you, Madam Chair. I know that on a regular basis, it happens infrequently, but Chair Liebling and I share a concern about that subdivision 10, and I'm just wondering, I'm going to add a different wrinkle to it. It is not to suggest in any way, shape, or form that I disagree or take exception with the focal point of this legislation, but I do wonder, now that I sit on judiciary, I wonder if there would be the opportunity for a court challenge from a legal perspective in terms of, because we are inserting a subjective appreciation for when that occurs. And if some might take exception with that, I'm wondering even if the legislature determines that it has ceased to exist, I'm just wondering if others might take exception with that. Just an opinion. My counsel sits at the end of the table. Whether or not he wants to weigh in on that, he certainly can. He's still got my dollar bill. But to my point is, as I look on page 3, lines 3.25 and 3.26, and we hear about the formation as well as the ongoing operations of a number of councils, but I am unaware of a council that also then has the authority to move legislation forward, as this would imply. And so I'm just wondering if Chair Moran or someone could help me understand, is this the exception to a standing rule precedent, or are we moving into new territory with regard to establishment of councils?
Chair Moran.
Madam Chair and Representative Albright, so it says with community input, advance legislative proposals to improve racial and health equity outcome. The good thing about that I think is about this here council is that they are working in partnership with the Commissioner of Health VHS. And what that allows them to do is have input into our ear to say, this is what we believe. They don't move legislation. We are the only ones who can. But they make recommendations to the department, and the department comes to us for any movement around that or conversation around it. That's how I interpret it.
Okay.
And Madam Chair and Representative Albright, I think that's what we do all the time, whether it's our constituents, whether it is a lobbyist, you know, they come to us with their recommendation, they come with us with language, we put it into a proper form for introduction, and that's how it moves in this body. I think this is that type of reference there.
Representative Albright.
Madam Chair, Madam Chair. I appreciate the answer. I think what we typically do in committee is informative because it does go to legislative intent. And just having a dialogue about what the intent of the legislation endears itself to from the perspective of the operational aspects of the council, I think that's appropriate to have clarified. Because as you said, the legislature is the only body that can move legislation forward in the kind of the triumvirate. So I appreciate the efforts on behalf of the council. I just was looking for clarification.
Madam Chair and Representative Albright, we've noted it and we'll work on that language.
Madam Chair, Representative Albright.
Reverend Jean Lean.
Yes. I also wanted to say that this, and obviously the language might need to clarify it more, a number of members on the council have legislation which includes the councils of color and the ombudsman for families. And the council is supposed to be supportive of the legislation that they bring forward. So I think that was the basis of which they started saying, yes, the council could, support, various legislations of the members as it meets the goals of the council.
Okay, thank you. Representative Albright? Oh.
Mr. Chair, my attorney, I
Representative-
think, has a comment.
Okay. Representative Pinto?
Thank you, Madam Chair. I guess just was noting that some of the cultural, and I know that the cultural and ethic councils that exist now, such as the Council on Minnesotans of African Heritage, do also advance legislation as well, just to comment on that. So I do think that there is a precedent for that with our other councils. I had a point on something else too, but I wasn't sure if Representative Albright was done.
Okay, thank you. Any other members? No questions?
Oh, then I will.
Yeah, Representative Pinto.
Thank you, Madam Chair. I wasn't sure what the status was. So I just wanted to also note regarding the expiration, I slightly share Representative Albright's point that if it's just left as is, there is the concern. This is regarding, it expires when disparities no longer exist, that there is, I guess, would be a potential for litigation, or there is a subjective point there. But then I really liked Representative Liebling's point, Chair Liebling's point, that that really should be a legislative determination. So just as this moves forward, it may make sense, Chair Moran, to consider maybe it expires when a legislative resolution is passed stating that disparities no longer exist or something, to sort of to put that onus on us, have both an objective test, but then absolutely to keep this aspirational point that this work needs to continue until disparities no longer exist. I'm so grateful to you, Madam Chair, for your work on this, but in this area more broadly. And thank you so much. Thank you.
Thank you. Members, I'd remind you that this is going to go to government operations too. So, and just one final thing, Chair Moran, my other concern, I've attended some of these meetings myself. It's been a little while. But my other concern is that the representation is statewide, and I believe usually when we're identifying who has come and where, it's more metro, suburban centric. So I would encourage you to seek others in the state that would maybe bring a different perspective about what's happening around the state. So with that, Chair Moran, do you have any other comments?
I guess my final comment is Chair Keel, is that I agree with you. It needs to be more statewide. We need to have rural representation. My amendment to this would be that we make sure that we have more community members, parents who've been impacted, also a part of that. And for those community members and parents who are traveling a distance, that we also, validate that and give them a stipend for mileage, childcare if we need to, because I think those real lived experience and that travel is important to the outcome and decision-making on the council. So I just want to say to Von John over here, who was the chair and that original core group of individuals who came together, did some really deep work and deep conversations to just lead this council to have, one, a strong relationship with the department, but also bring those perspectives and input from the community. But, not just a perspective, it's like foundational work that has taken place to really work towards reducing and one day eliminating the disparities that we see impacting our community. And then to the current chair, thank you for, taking the lead on how to go to the next phase on what we need to do for communities of color and indigenous communities. So with that, I ask for your support of House File 771.
Okay. Being no further discussion, Chair Moran renews her motion that House File 771, as amended, be recommended for re-referral to the Committee on Government Operations. All in favor, say aye. Aye. Opposed? Motion prevails as amended and recommended for re-referral to the Committee on Government Operations. Thank you. Chair Moran, where would you like to head next?
Chair Keel, can we go to House File 3276?
Okay. So, Chair Moran, I understand you have a A2 Authors Amendment. So would you like to move your bill and amendment?
Yes, ma'am.
I guess I should give you a couple minutes.
Madam Chair, I'd like to move House File 3276 and be recommended for a re-referral to the Judiciary Finance and Civil Law Division. I would also like to move the A2 Authors Amendment.
Okay. With that, members, all in favor of moving the A2 Authors Amendment, say aye.
Aye.
Opposed? Motion prevails. Chair Moran, you may present your bill.
So just some quick information about the A2 amendment. So this amendment was developed with input from the national experts in its practice and county partners and DHS. This bill established the practice of a comfort call named to help decrease trauma for children when they experience an out-of-home placement. Comfort calls are designed to equip foster parents to connect with birth parents or guardians within the 48-hour of displacement. The goal of the comfort call is for caregivers to connect to share information about the immediate need of the child, such as allergies, nighttime comforts, the unique need or preference of the child. Even more importantly, is the role of the comfort call to establish the foundation for a positive relationship between foster and birth parents for the purpose of enhancing care for children in out-of-home displacement. This proposal designates the responsible social service agency to coordinate and equip the most appropriate person, foster parent, case manager, or person in a caregiving role to call the birth parent or the guardian. Calls are conducted in the best interest of the child, and exceptions are included for circumstances when birth parents or guardians are not able to participate on a call. So here with me, I have some testifiers. I have Darlene Bell here. I think will be a great testifier into this process of what a comfort call is.
So Darlene Bell, would you like to introduce yourself for the record? And you can go ahead with your testimony.
Good morning, Madam Chair and committee. My name is Darlene Bell. And
Go ahead.
okay. My name is Darlene Bell, and I am a foster parent, a kinship parent, and an adoptive parent. Me and my husband have been foster parents for over 33 years, and we fostered over 30 children. We have 6 children of our own, 18 grandchildren, and we've adopted 5. So this whole comfort call piece is a piece that we know oh so well. Can you just imagine being a 3-year-old and you're removed from your parents, just abruptly removed and placed in a home with complete strangers? The comfort call literally helps decrease the trauma in these kids in the first 24, 48 hours to at least call that caregiver, the bio family, to get information on if it's just what helps soothe the child as far as what they eat or their sleeping habits, or just to know that everything is okay. And or their favorite blankie, their favorite toy. And so that comfort call piece is really the foundation of the foster parent and the bio parent and the child to just really decrease the trauma.
Okay. Let's see, testifier next, Trish Skophammer, is that correct?
Madam Chair, it's Trish Skophammer. Yes.
Skophammer, sorry. Thank you. Would you like to go ahead and?
So we're going to move to the general bill itself. That is around the parental payment of the foster care system.
Thank you.
Ms.
Madam Chair.
Skophammer, can you identify yourself for the record?
Yes,
Go
my
ahead.
name is Trish Skophammer, and I currently serve as the Director of the Child Support Services Division in the Ramsey County Attorney's Office. I'm happy to be here today and happy to be able to offer this information. Under current law, when a child is placed in out-of-home displacement, either through a child protection action or through a juvenile justice action, the law requires that there's a reimbursement. There's some cost of care language in the statute. And there's a couple of different ways that can happen, that reimbursement happens. It sometimes happens through the child support agencies in counties and sometimes happens through parental fee agencies. There are also multiple ways that the money is collected. It can be collected by setting an obligation for child support. It's actually called child support to help reimburse on a monthly basis. Or it can be a parental fee that we might look at ability to pay again on a monthly basis. It also includes redirecting existing child support orders away from a removal parent to reimburse the government and redirecting payee of Social Security benefits. The language in the statute is very directive. There's not a lot of room for discretion or ability for a person to make a decision that it's not in the best interest of a particular family. And so the language that we're looking at adding would allow some discretion and requirement that we pause before we start taking money out of households and determine if it's really going to be in the best interest of that family. Some of the things that we know about families who experience out-of-home placement really indicates that this is a hardship for families. Families are already in crisis as soon as their child is removed from their home. Even leading up to that removal, we know that these are families in crisis. We know that the vast majority of families who experience out-of-home placement are poor. We have some data that shows that up to 80% of them are surviving on an annual income of less than $10,000. And then we, being the child support or parental fee agencies, come in and say, now you need to also pay for this. And sometimes they're still paying back after their children are returned home. We know that this problem compounds the racial disparities that already exist in out-of-home placement. And sort of on the other side of the coin, we know that this is a hardship on families and it's difficult on families, but we also know that the practice is not cost-effective. We are not very successful at collecting money from poor families, and we are required to put a certain amount of effort into it. And when you look at the overall amount that parents contribute, it's about 4% of the total cost of out-of-home placement. And when you look at the amount of government workers' time and energy that's expended, we're spending about $1 to collect about 30 cents. So it's not a cost-effective practice. And I have with me Michelle Bresnahan, who also would like to share a story that her family experienced.
Welcome, Michelle. Would you identify yourself for the record and go ahead?
Thank you, Madam Chair. Michelle Bresnahan. April 29, 2014, my son was a victim of a very traumatic event done maliciously by a person we loved and trusted. Prior to this, he was a typical 14-year-old that was obsessed with racing, motocross, playing hockey, and was not prone to getting into trouble. After he changed almost overnight into an angry young man who hated the world and everything in it. He started getting into trouble immediately and very quickly spiraled out of control. At 16, he broke into a home with 2 other boys that included the boy that lived there. As a parent who believed in doing the right thing, I forced him to confess right away. The others did not. Ultimately, he was charged with first-degree burglary with extended juvenile jurisdiction, despite having no prior history of theft or any other serious charges. The first night he spent at Washington County Jail, we were given a financial information request form. We submitted the information as quickly as we could because that's what you do. After several months of asking, I was told that based on our combined household income, we would be responsible for the entire bill for jail. Now, I'm a county employee, and my husband was working for the federal government at the time. While we were financially comfortable, we certainly would not be considered wealthy. Very middle class. Eventually, we got an estimate of a 9-month sentence at the Eastern Regional Juvenile Detention Center.
we were looking at $250 a day for 9 months, which comes to $67,500. It ended up being $199 a day, which comes to $53,730. During my son's incarceration, we had a drastic change in our income. Initially, Washington County told us nothing would change. I know I could request a hearing, so despite this, so instead, Washington County eventually agreed to reevaluate our income. We ended up, after all was said and done, paying approximately $23,000. Through the sale of our home, we lived in for 12 years, we paid it off. Keep in mind, this is also on top of the attorney fees, the treatments, the psychologists that we still continue to pay. Thank you.
Thank you, Michelle. Appreciate that. That's a difficult thing to talk about, isn't it?
Yes.
Yes. Is there anyone else that would like to testify in the audience? Seeing none. Members, do you have questions? Chair Liebling.
Well, first of all, Madam Chair, where's this bill going?
Judiciary, Finance, and Civil Law.
Okay, so I guess the question I have is, what is the sort of the federal law basic requirement here for us? Because when I look at this, and thank you so much to the testifier, I just wonder, instead of doing it this way and saying that the sort of the default is we charge the parents, and then there are all these things here in the bill, which is good. Let's think about whether charging the parent is the right thing to do. It almost seems like we should flip it around and say that the default is we don't charge the parent unless something, you know? And I wonder, sometimes we don't do things that the more logical way because federal law requires us to do something. So that's kind of my question, like, why are we doing it this way in the first place?
Ms. Scott-Bahner?
Yes, thank you, Madam Chair, members of the committee. The federal law pertains only to the foster outplacement funding that is funded by federal government. So there's two different pieces there. And the federal law is pretty discretionary. It says that there shall be a referral to child support for cost of care, although they use different language, in situations where it is appropriate. And then they go on to provide some examples of when it's appropriate, when it's not appropriate. And when it's not appropriate would be short-term placements, although they don't define what short-term placements is. They leave that to the discretion of states and counties. And then if the payment would interfere with plans for the child to be reunified. And so there is already some discretion under federal law, and this change in state law would not be out of alignment with federal law.
And Madam
Chair
Chair.
Liebling? Oh,
I also just
Representative
want to add, not
Moran.
the federal law piece of it, but we have a Minnesota law that requires, right, the parents to contribute to the cost of their child out-of-home displacement. And what we're finding is that most of the families that define themselves in out-of-home displacement or a criminal act is they're very low income, and they just can't really pay for it. So it really is, it's become really detrimental to families trying to, for the state to try to collect these dollars. And so every dollar that it costs for us to try to collect, which only is a 30 cents reimbursement. So it's just, it costs more to try to get the money than we are recouping from that family. And so collection only ends up reimbursing about 4% to the government total cost at 4%.
Right.
Chair Liebling?
Madam Chair, and thank you for that. And I'm kind of understanding that. And that's kind of the basis of my question, Chair Moran, is that what the bill is doing is trying to take the existing law and make it a little more humane and a little more rational in terms of what you just said, the cost and how much we get. And I'm just wondering if we have the actual flexibility vis-a-vis federal law, which it sounds like we have quite a bit, whether we wouldn't be better off to kind of rethink the whole thing and flip it around and say we don't go after the parents at all except in some more limited situations, one of them being income and you know? I don't know, just, I'm looking at this for the first time, but that's just kind of my reaction to it is, you know, yeah, we have this in state law, but that's why we're here. We can change the state law, and, you know, maybe we should, I guess I'm suggesting maybe there's room to think even bigger than this, and, you know, because clearly, the cost of administering things, and, you know, I would hope if we could, one would hope that we would see a fiscal note that would also show a reduction in personnel needed to go after the money, you know, or something like that, or that we could, you know, the administrative costs are often, you know, we throw a lot of money after things that really sometimes are counterproductive, and it sure sounds like that's what's going on here. So, thank you.
Chair Moran, did you have any comment?
No, I agree, and I noted in my notes that as it moves through the body, that we can look at other language maybe and see how that works out.
Okay.
Yeah. I did note that, you know, looking at parent will only pay in certain circumstances, you know, if it really makes sense, but we'll have to define what that is. Yeah.
Representative Edelson?
Thank you, Madam Chair. Thank you, Representative Moran, for bringing this. I guess I'm shocked that this happens. As somebody that's worked in child protection, that has worked on juvenile justice reform, I'm sorry about your story. The last thing a family needs to do is be hit with a bill, really what you're going through your own trauma. And so we need to help you. So very supportive of this bill, and just thank you for bringing it.
Thank you.
Okay, Representative New?
Thank you, Madam Chair. My question, Chair Moran, would be, this is a fascinating number, the $1 to 30 cents and the 4%. My question is, do you know what that dollar amount is, that 4% statewide?
I wouldn't, would you?
Ms. Bahner?
I'm sorry, Madam Chair, Representative Newt, I'm going to pass that on to the testifier.
Ms.
Yes,
Bahner?
thank you. So again, I'm Trish Skophammer. I do have some data. The data that I'm looking at is from 2015, so it's not super fresh, but we can certainly get new data at any time. And what we found was that in 2015, we collected about $3 million across the state of Minnesota, and that's on the child support side of things, so it doesn't take into consideration any money that was collected through parental fees or through the redirection of Social Security. To my knowledge, nobody's looked at the big picture of all of the collections. But on the child support side of it, that $3 million represents 10,000 cases. And so in a year's time, the average collection per case is only $300. So it's not a huge amount of money that would be, that we would be talking about in terms of state budgets, or I'm sorry, county budgets. One of the concerns that has been raised at the county level is that if we were not collecting from parents, that would affect some of the revenue that comes back in to the social services budgets.
Representative New?
Thank you, Madam Chair. That's of course the concern, particularly, you know, when I talk to my county commissioners, they've addressed this very specifically with me a number of times, that out-of-home placements have increased drastically over recent years, and they attribute that primarily to the opioid epidemic. And because of that, this is already a significant budget issue at the county level that they're having to eat. So what I'm interested in here, so there's the $3 million on the child support side, but no one has looked at this in totality. So we're removing those other fees as well. Do we have any idea what those dollar amounts are? I'm concerned that we're moving this forward and we don't really know what this impact is on counties.
Okay. We can get, we'll work on those.
Chair Moran,
Madam
excuse
Chair,
me.
Representative New, we can try to get those numbers, but I want you to know that this came from the counties, right? And it came from the county because they're spending more than they're putting in, than they're receiving. And it's just not adding up for them. And it also is putting a extreme burden on families who are not capable of of paying their share that has been requested from the county. So not only are families dealing with their own personal trauma, not only are they dealing with, maybe a court case or a child being removed from the home, all those factors couple on the impact it's having on the individuals who's going through not only that child, but the parents themselves, is that we have a county that's saying, we're not recouping the dollars. It just doesn't make sense.
Representative Noon.
Thank you, Madam Chair. I think that's really significant, actually, and I agree. I think, largely we're talking about families who can't afford these costs and fees, which doesn't make sense. And I think it's significant that it came from the counties. Is this coming from the Association of Minnesota Counties? Is it coming from a couple of counties? Do we know where that is? I just want to make sure that everyone is well informed and knows what will be happening with this.
This proposal.
Skophammer.
Yes, I'm sorry. This is Trish Skophammer again. Thank you for the question. This proposal comes out of Ramsey County, the Child Support Office in Ramsey County, and based on some research that I've been involved in. We do have the support of the Minnesota Family Support and Recovery Council, which is the child support state agency that provides training and does an annual conference and has representation across the state from child support agencies. We do not have the support of the MACSA, the Minnesota Association for County Social Services Agencies. And again, I've spoken with that group a couple of different times, and the concerns come up about revenue. And the one thing I would say about that is that there are a lot of services that are provided for families in need, including public assistance, medical assistance, other types of assistance, and we don't ask families to pay back that amount. And so this is sort of an outlier in terms of services that families require that we then turn around and ask them to pay for when we don't do that in other areas.
Okay, Representative New.
Thank you, Madam Chair. And I appreciate that. So I have concerns with this then, that it sounds like this does not necessarily come from all the counties, and perhaps we need some more input on it. Do you know this 4% number and the $1 to collect 30 cents? Do we know if that applies across the board, across the state, or are there counties for whom this actually is not the case and they are recouping more of these costs?
Trish Skophammer.
Yes, Trish Skophammer, and thank you again. There is differentiation between counties, so the numbers that you've heard today are statewide averages, and there will be differences across counties. And part of the reason why the bill was written the way it is, proposed the way it is that it gives counties with different demographics the discretion to look at the needs of what's going on in their communities with the families that they're providing services to. So in some communities, families are very low income. In other communities, families may not be as low income. And so those counties where they're not dealing with such extreme poverty, they may have more cases where they're able to set collections, whereas in my county, for example, we would probably be less likely to collect because we know more about the families that come into our programs. So it leaves open some opportunities for counties who are really looking at that revenue sources and being important to be able to still do some collections if it's appropriate given the families that they serve. So it doesn't take away their ability to collect.
Representative New.
Thank you, Madam Chair.
And Madam Chair and Representative Newt.
Yes.
So
Chair Moran.
we're going to continue to work on this. I will also check in with the Minnesota Counties Associations. But what I do know with other bills that I've carried, that when they were opposed to it, they have come to my office. They do show up, and they do testify. And so, but I will do a follow-up to see where they stand on this issue for some clarity.
Representative Pinto.
Thank you, Madam Chair. I just wanted to just make sure I'm understanding the sort of what the state of the current law is. And this is maybe from Ms. Skophammer. I'm just looking at the page 2 of the bill. That as I read this, it seems like maybe the intent of the current law is to have parents pay the hand over the resources that they would have spent on their child. And so maybe that was, I'm just trying to understand sort of why the current law would be set up as it is, that the court has to order parents to pay these funds over, and the way it says to income and resources attributable to the child. I'm just wondering if you can comment on whether that was sort of might have been the intent of the law as it's set up right now?
Yes.
Trish Scopehammer.
Hi, Trish Scopehammer again. Thank you for the question. I can only speculate on the intent of the law, but there has been a history in child support of it being a reimbursement program set up originally to reimburse the cost of AFDC. There has been a big shift in recent years in a Families First approach, with most of the collections, 96% of the collections that come into the child support office go out to families, and only 4% is kept to reimburse the expenses of either MFIP or foster care is another example. So there's been a big shift, and I don't think that the laws have necessarily caught up. But when you look at the assets and the income attributable to the child, that specifically refers to existing child support orders and existing Social Security benefits that may be a derivative benefit from something that going on with either a parent. And so there's the sort of this idea that these benefits, child support or Social Security, follow the child. But if a child is only out of a home for 6 months or 3 months or some time period like that and is returning to the home, their day-to-day needs are being met elsewhere, but their need for shelter and a home to come back to doesn't change in 3 to 6 months. And so it's really important that those funds stay in the family.
Just to
Representative Pinto.
Thank you, Madam Chair. That's really helpful, because I mean, it does, and I so much appreciate the testifier to your right describing her family's experience. I think that any of us listening to that, it just does not make sense that a family should have that cost burden. That just makes no sense to me at all. And I'm looking at the statute and just trying to kind of sort through what the thinking may have been. Because again, I could imagine a certain logic that if there's some placement, you say, well, these are the funds that would have been spent on the child, and they would then be handed over to the folks who are now providing care for this amount of time. But that is not what sounds like was happening in that situation, or in many others. So in any case, but getting away from this approach and the way the bill is, I think, makes a lot of sense. So thank you, Chair Moran, and thanks for answering the questions, Ms. Scopehammer. Thank you, Madam Chair.
And Madam Chair, if you don't mind,
Chair
I just
Moran.
want to reiterate for this committee here, before we move on to government, to judiciary, is that with the Family First legislation that we have conformed to, we really are moving in a different direction. With the opioid crisis and the number of kids who are being removed from their homes, we're looking to how do we support families, you know? And so this is just really is in conflict of where we're going.
Okay. Chair Liebling.
Well, thank you, Madam Chair. I just wanted to confirm that this does have a number of stops, and so the fiscal discussion in particular, we will have that. We're not deciding that all here. So, I mean, there are some unknowns there, definitely. But hopefully we'll get some more clarity as we go forward with the bill. But thank you, Representative Moran.
Okay. Chair Moran renews your motion to that House File 3276, as amended, be recommended for re-referral to the Judiciary, Finance, and Civil Law Division. So all in favor, say aye. Aye. Those opposed? Okay. Motion prevails. House Files 3276 as amended is recommended for re-referral to the Judiciary, Finance, and Civil Law Division. Thank you. Representative Kresha, would you like to join us? I think she's not. She said stay here. Welcome to the committee, Representative Kresha. Let's see. The chair moves that House File 1732 be recommended for placement on the General Register. Representative Kresha, we have 2 amendments in our folders. I understand that you would like us to move the A20 0657, delete all amendment, and that the A20 0653 amendment tracks the page and line changes. Would you or Ms. Sunderman like to offer additional explanation before we move the amendment?
No, Madam Chair, just this would put the bill in the shape that I need for discussion, so if we could do that, that'd be great.
Okay. So the chair moves that A20-0657, delete all author's amendment. All in favor, say aye.
Aye.
Opposed? Motion prevails. Representative Kresha, please present your bill.
Thank you, Madam Chair, and thank you, members. I know you've had a number of bills today, so I'll try to be brief. What you have in front of you is just simply a reorganization of the 626-556 Maltreatment of Minors Act. And this comes back from the governor's task force that we actually had, I think it was 5 years ago, maybe longer. But one of the initiatives that came out of there was just to reorganize this, no substantive changes, but to reorganize it, because when we make changes to this, the way it was structured, it was really like a quilt. There was stuff everywhere. So by reorganizing it, whenever we go back in and want to make substantive changes, it'll be easier for the revisers, it'll be easier to follow, and it'll make it more efficient. So there is, and the reason you have the delete all, and I want to thank the revisor's office, Ms. Sunderman and everyone else, we've been working very, very hard to get this to be exact, because there is another body in this town that frankly makes things very difficult for us because they don't agree with the punctuation changes that we make sometimes. So we've had to literally get this down to pixels on a computer so that they would be agreeable. And we believe we have that. And what we have here is something that is almost identical to what they're going to be offering. So we can avoid conference committee, and I won't have to spend any time in the room with them. Did I say that on microphone? I'm sorry.
Well, with that, Representative Kresha, would you like to have your testifiers come forward?
What unless there's any questions, I mean, like I said, this is just a reorganization. I can take any questions. We're not making any changes to the law. I'll take those and I can bring them up if we need, but really that's all the bill is.
Okay. So is there anybody from the audience that would like to testify? There we go. Is it Mr. James Dunn?
James Dunn.
Yes. Would you please identify yourself for the record?
So James Dunn, I've testified on this particular article like 3 or 4 or 5 years in a row now for the same reasons.
Sir, can you get closer to the mic?
Yeah.
Thank you.
I mean, in the past, the big issue for me was I've had a child that's been in a dangerous situation, and I've had child protection services engaged for the longest time, and it's been as ineffective as you can imagine. Eventually, things are going in the right direction out of court, but it's not based on anything that was completely missed with child protection. But my biggest issue in the past has been the mental health, the final blow provision on page 21. And so what that was it was basically one of the punctuation items where it said, in cases of alleged maltreatment resulting in death, the local agency may rely on the fact-finding efforts of law enforcement to make a determination of whether or not maltreatment occurred. We added the comma. Before it just said, when necessary, the local welfare agency shall seek the authority to remove the child from the custody of the parent or guardian after that. So it was basically the grammar definition where a grammar teacher might say, the comma is important.
Just 1 second.
Madam Chair, and I want to track
Chair.
with what you're saying.
Representative
And so
Albright.
I'm wondering if we can pause and so that we can all get to the same page that you're talking about?
Yeah.
Could
Could
you
we
just
and
identify
line
the
numbers?
page in the
Page
amendment?
21.1 through .5.
Just a second.
In
Article 1, Section
Is this the amendment or the
Is
original
this in
bill?
the DE?
A20-0657.
Okay.
So-
Thank you.
I'm just a dad. I don't know.
Representative.
So
Representative
just-
Albright.
So it is on page 22 of the A20-0657.
And the basis was, the grammar teacher
Mr.
might.
Dunn.
Oh, I'm sorry.
What line number?
Well, just wait. What line are you
I
in?
was on, it's section C and D, so 21.1 and goes on.
What?
Of the
Section-
A20-0657, Madam Chair?
Right, I've got the very top
21.31.
line through the next 5.
Okay.
So we're starting on page 21.
Just a second. Let's go through the chair here. so we don't get too confused.
Madam Chair, so we're starting at the
Representative
bottom
Albright.
of page 21 to begin with, and then moving on to the top of page 22?
Is that, Mr. Dunn, is that correct? Bottom of 21,
Top.
going to the top of 22.
Top of 21, 21.1 on my page that I picked
Well,
up in the
that's C.
hallway.
Okay.
Thank you, Madam Chair.
So we're on C of line 21.1.
Correct.
Okay. Is, members of you, are we all in the same spot? Okay. Then, Mr. Dunn, you can go ahead.
In 626.556, where this language was lifted, paragraph C and D was all pushed together. And when I spoke with the Child Protection of the St. Louis County, and I said, well, what does it take? We've been through multiple safety plans. We've been through multiple findings of maltreatment. What does it take to protect my kid as a dad? How do I do it? And they said, well, it goes through the county attorney. I said, so when do you step in and remove them from the situation or protect them? So, well, we don't really protect children. They can't prevent child abuse was the phrase that was used. So when can they be removed? And the only legislation that I found was that, in cases of alleged maltreatment resulting in death. And those two paragraphs were pushed together in the last bill that's currently in 62556, subdivision 10, section 5. And so it read completely different. So this fixes the final blow bill, the only part of that maltreatment report that said a child can be removed. So then it goes back into the litigation, into the courtroom. So the second part, and I won't reference the language, but there's language in here about penalties that talk about it's a penalty if a mandated reporter fails to report. It's a penalty if someone makes a false allegation of a report. But there's not an actual penalty in this bill that makes it illegal to abuse a child or a criminal penalty to abuse a child. That's a completely different section of law. There's nothing in here that says, you know what, if you abuse a child, you're going to go to jail. You're going to do this. You're going to do that. I don't see it in that part of the bill. And I'm a dad, so I'm not, I'm not an expert on this. So the other piece is there's immunity in here that talks about the officials that are immune from any sort of liability. And so let's say a child has 8 years of involvement with child protection and something terrible happened. Who's responsible? If it wasn't, now you've got to be able to prove that someone wasn't acting in good intent or wasn't acting in the best of their abilities. Now you've got to really unravel, how do I fix this? I would say the biggest issue that I've been dealing with is mental health. So on page 10, mental health, I'm going to point out section 10.3 on page 10. It's section 3. It says neglect under subdivision 15 that substantially endangers the child's physical or mental health, including a growth delay, which may be referred to as a failure to thrive that has been diagnosed by a physician and is due to parental neglect. That is one of the screening intake requirements to protect a child. If I'm not a physician, I can't say, that's mental abuse. Mental abuse in here is defined as physical abuse. Child protection screening intake people, they cannot declare that a child has mental abuse because they're not a psychologist, and this
Mr.
law
Dunn.
requires that.
Yeah, okay, can we have Representative Kresha, could you respond to?
Sure can.
Thank you.
Well, first of all, thank you, and I wish everybody would read through the statute changes as well as the testifier. And what he's pointing to are substantive changes and conversations we should have down the road. What we're trying to do here is just reorganize it so then we can get to that conversation and other ones, because one of the things about the 626-556 statute is there's lots of varying interpretations of how we should apply this. But until we can reorganize it and put like things by like things, those conversations are just very, very complicated. So what I'm asking here, and what the testifier here is asking for substantive changes. Let's get to those conversations, and maybe we can offer some bills and have those conversations and get to all the broad populations that are affected and their viewpoints. But in order to get to that, I have to reorganize the statute so it makes it simpler for our revisers and so forth when we make those changes and bring them from the committee, if that makes sense. So I'm trying to do this in the right order. I want to get to his questions in another bill and another conversation, but until I reorganize it, until I put the map together, we're just kind of lost.
Okay, thank you. Representative New, do you have a?
Thank you, Madam Chair. And to the testifier, just a clarifying question. On page 21, that section, and I just want to make sure I was understanding what you said, and I may not have. Did you indicate that by separating these two, that C is separate from D, that actually has largely fixed that problem?
I mean, C
Mr.
is still
Dunn.
the, oh, I'm sorry.
Go ahead.
Sorry, process. C is still a final blow provision in the sense that it's investigating after a dead child, and I'll point out that the report from 2018 shows 57 near fatalities or dead children in Minnesota, 31 near fatalities and 26 dead children, including 9 involved in child protection that were misses. So that is the final blow provision. It didn't work for so many kids. I mean, the out of 86,000 screened in or reports, 30,000 were screened in. That's 56,000 that weren't. And of that, there were 38,000 victims in 1 year alone. 5,000 of those had prior assessments, and of that, 22,000 of those, the CPS's own statistics had prior screened out reports because the screening's not getting screened in. Of that, there's requirements in here, and I hope that answered your question, but these screeners have 15 hours of required yearly annual training. They're not experts to screen these in.
Okay. Representative Kresha, do you
Yep,
have
and
a
I
comment?
would just if I can help Representative New and help the answer here again. This bill has no substantive changes. We're just reorganizing things. The questions and concerns that are being raised will still be questions and concerns after this passes, because all we're doing is moving things around and clarifying. Everything that is being brought up, I don't want to dismiss it or affirm it or any that's a separate conversation that we need to have. And what he's calling attention to, which rightfully maybe so, it could be a conversation to have. It's just here we didn't address that. Nothing we did here changed anything. So we didn't make that problem better or worse. We just restated it correctly so we could get it in the shape that we need to have conversations.
So maybe what we need to suggest is, Mr. Dunn, would you work with Representative Kresha on future discussions about making sure we get this in the right way and then move on forward?
I would love to. I would start with not lifting 66.556. I would lift 343.21, which has torture, deprivation, nourishment, confinement, abandonment, cruelty. They have penalties, felonies, jail, misdemeanors, restitution, restrictions on other victims. It requires a burden of the abuser to show clear and convincing evidence that they're fit to have custody, limits to future custody or other custody. And they have periodic visits by officers, community service, psych and behavioral counseling. This never happened with me. I haven't had a single follow-up call. I haven't had anything. So I think we're lifting the wrong bill. The bill that we could be lifting is 343.21, which is the prevention of abuse to animals. All that we need to do for an amendment is change the term animal to include all animals, including humans.
We're going to need to move forward, so thank you for your testimony. Is there any other members that have questions? Oh. Representative Pinto.
And just really quickly, I just want to thank Representative Kresha because he's been working in this area for a really long time, and this is really tough and really important work. And so, thank you for doing it. Thank you, Madam Chair.
It goes to the revisers and the
Representative Kresha.
researchers.
Yes.
But thank you.
And it is a difficult conversation. If we could fix things really quick, we would.
Correct. We have to get it right, and that's very hard.
Okay. With that, members, being no further discussion, the chair renews my motion that House File 1732, as amended, be recommended for placement on the general register. All in favor, say aye.
Aye.
Those opposed? House File 1732, as amended, is recommended for placement on the general register. Thank you.
Thank you, Madam Chair,
Representative
members.
Kresha. And I believe we're Representative Halverson?
So members, so we took public testimony on this bill on Wednesday, so today is for us to ask questions and discuss the bill before voting. I'm going to start by moving a bill again, and then we can adopt the A1 amendment that we adopted on Wednesday, the A1 amendment. So the chair moves that House File 3032 as amended be recommended for re-referral to the Committee on Commerce. Is there any discussion from committee members to the bill? Representative Albright.
Thank you, Madam Chair. And Representative Halverson, in a number of instances in the bill, the bill recognizes lobelia delivery. I don't know what that means.
So, Representative Halverson.
Madam Chair, Representative Albright, you are in good company. I once knew what lobelia meant, and I was thinking just this morning, I forgot. So I'm going to phone a friend, Madam Chair, if I may have one of my testifiers respond.
Welcome to the committee, please.
It comes up ever so, yeah.
Yes. Introduce yourself for the record and proceed.
Thank you, Madam Chair. My name is Molly Moylan, and I'm with Clearway, Minnesota.
A little bit closer, please.
Absolutely. Molly Moylan with Clearway, Minnesota. And lobelia is from a plant. It's a plant that has a lot of the same constituents as a nicotine product. So years ago, as the definitions of tobacco product were evolving, we were starting to see lobelia-based products in stores. It hasn't taken off. We haven't seen them proliferate, but they are around. And so, again, as a comprehensive definition of tobacco product, lobelia has been included in that because it has a lot of the same. It was like a proxy for nicotine. It is in the definition throughout statute. There's a separate section for it where it was, included. And that's why in pretty much all of the youth access laws and tobacco statutes now, it is cross-referenced with that. But is it a product that we're seeing widely used or becoming more apparent or included in other products? We're not seeing that.
And Madam Chair, just to
Representative Halverson.
to follow up on that and to clarify for the members, it's not a new definition and it's not new to state law. This is keeping everything consistent with state law with all of our definitions. So if you look throughout statute, lobelia is included in all of these definitions. And so it's not something that's new. In fact, it's been around so long, I forgot what it was, so.
Representative Albright.
Thank you, Madam Chair. And Representative Halverson, and to the testifiers, lobelia, I'm still not sure. But is it, would this also have ramifications much like, trying to think of the word, holistic medicine? So would lobelia be indicative of, trying to think of the term for, would that also relate to almost like a transition to cannabis? Or where does lobelia, I appreciate your definition, it's not about that, but I'm just trying to get a cross-reference in terms of some of the other topics in terms of addictive and/or scheduled drugs, and if that is part of the dialogue here or not.
Representative Halverson.
Madam Chair and Representative Albright, when it comes to tobacco, we know that there have been many ways to twist and turn what tobacco and nicotine delivery products are. And keeping up in statute is challenging. And so the definition that we have in statute is a reflection of trying to keep up with the twists and turns in the tobacco and nicotine delivery market. And this bill continues to work to expand that definition to make sure that we are addressing all current nicotine delivery products. And as we saw, since we heard this bill last year, or started hearing, I didn't hear this bill last year, sorry. Since we started hearing vaping bills since last year, we have a whole new group of products that are on the market that didn't exist when we brought these bills forward. And so it's creating definitions that keep us ahead of the nicotine delivery industry, who get ahead of our own state laws and state definitions.
Representative Albright?
Thank you, Madam Chair. Representative Halverson, so can lobelia be delivered in much the same manner as nicotine?
Yes, Madam Chair.
Representative Halverson?
Madam Chair, yes.
Yes. Representative Albright?
Thank you, Madam Chair.
Representative Pearson?
Thank you, Madam Chair, and obviously this was not the only tobacco issue we were dealing with that day, and I'm just still trying to get my mindset back to that day when we had started these discussions, because I was breaking into the statutes that day and pulling them off. And one of the things I was trying to determine from an enforcement standpoint, it's just a little tricky, and I'm just completely curious because I couldn't figure out the answer that day, and now I'm even more confused of where my brain was that day. So I'm sorry if this comes off disjointed. It's possible to have a vaping device that has zero nicotine, zero tobacco in it at all. Does this bill get to a device like that? Would that be outlawed? And I'm going to broaden the question while I ask it so I don't have to go back and forth a little bit. But I'm trying to get to the fact that for enforcement standpoints, if somebody's using a device and there's the smoke, obviously the smoke in the car, we were dealing with that issue previously. But it is actually possible, but under the Clean Air Act, I believe we outlawed that for an electronic device. I'm trying to give a broad question so that the answer can be more direct on I think the point I'm trying to make. I hope it's apparent. And if not, I can rephrase or try again.
Representative Halverson?
Madam Chair and Representative Pearson, and it's Friday morning and our brains are all catching up, so no problem. I think that I know where you're going with your questions. With regard to 0% nicotine, I'm going to throw air quotes out there because there is no oversight or regulation on how these products are manufactured. And so to have a 0% nicotine claim is just that, it is a claim. In fact, when you look at how they are sold in retail shops, very often they are the claims of nicotine delivery is actually handwritten on there. And so there's no oversight or enforcement with regard to how much nicotine is in a product that's manufactured. And so in order to be as comprehensive as possible and make sure that we are achieving our goal, which is to make sure that kids are not getting addicted to nicotine, we have a comprehensive flavor ban. So all flavored tobacco products and nicotine delivery products, other than those that are used in healthcare settings, would be banned.
Representative Pearson, is there a follow-up question?
Sure. And again, just because I'm just disjointed with last week's minors in the car and what I was reading that day, and I'm just trying to spell this out, because I was trying to, number one, make sure you were including everything you could and make sure that we don't have an enforcement issue. So a police officer, finds somebody who's using this or distributing the product, and then the person who's distributing it says, yeah, but it's 0% nicotine, 0% such and such, so this is not covered. We're clearly stating it is. Clove cigars, clove cigarettes, things, again, that don't contain tobacco per se, how are they dealt with in this? And again, I was really trying to focus on the last bill before this bill, so If you could kind of address those items as well, because it's kind of that confusion or blurred line of products that aren't included. I just want to make sure
Thank
we're
you.
not having issues.
Representative Halverson.
Thank you, Madam Chair. And I smiled when you said clove cigarettes. It took me back to high school when I was growing up in Representative News District. But they are considered a tobacco product, so they would be included in this as well.
Madam Chair. Right, and then I just realized I kind of omitted the final one would be a cannabis reference was brought up earlier. Is that covered in this in any way, shape, or form?
Representative Halverson.
Madam Chair and Representative Pearson, cannabis is not included in this. Currently under Minnesota state statute, cannabis other than for medical purposes is not legal, so.
Representative Edelson.
Thank you, Madam Chair. Representative Halverson, I'm incredibly supportive of this legislation. I looked at the student survey, and we saw with 8th graders a 95% increase. With grade 9, 75% increase. I mean, that's shocking. And I graduated high school in 1999. The big tobacco lawsuit was in 1998. And I remember watching a lot of my classmates, the smoking increased. And I think it wasn't until 1964, it was somewhere in the 1960s that we actually linked tobacco use to cancer. After decades and decades of people using tobacco, we linked it. And my grandmother died of COPD, and I watched as she gasped for her last breath, and it was horrendous. And what I fear right now is that we have an entire generation of young people that are being targeted with these cool devices that are super tech savvy. I mean, the lipstick device that you showed was, I mean, no adult is gonna use that when you're at work. I just find that very shocking, and the flavors, I mean, they're absolutely targeting youth, and it's reckless, and we've allowed it, and I just want to thank you for standing up on this issue. I stand with you.
Thank you. Representative Keel.
Thank you, Madam Chair. When we had testimony the other day, there was somebody that came across a business that suggested that we maybe move vape products behind the shelf. Is there some other way of controlling some of this? I actually have I'm surprised in a lot of different places, even healthcare professionals that have pointed out that that's how they quit smoking. They really appreciated the ability to use vape products, flavored products to quit smoking. And, you know, just looking at the business, and that's the suggestions that she made about moving them behind the shelf or restricting them in other ways. And I think we heard from someone that parents were actually buying for their kids. And you know, trying to control something in this world isn't necessarily going to get rid of it. But have you thought about maybe doing some different things with vape products?
Representative Halverson.
Madam Chair and Representative Keel, you ask a really important question, and the answer is yes. And this goes back throughout the history of tobacco use and tobacco marketing. Once that Surgeon General's report came out, and what the tobacco lawsuit actually just demonstrated is that before 1964, tobacco companies knew that their products were killing people. And they have a great advantage as if you can get your product into somebody's hands, your odds of addicting them are very great, because nicotine is one of the most addictive products that exists. And so they knew for years that their product was killing people. And they hid it, denied it, and thanks to the state of Minnesota for taking the leadership role, we know how they did that. And then we know how they marketed. And I liken it to the analogy that I continue to think of is, you know, if you had skunks sneak into your house through the back door and they were in your house, and you said, okay, I've got skunks in my house, and then they started to multiply, and it went on for years and years, and then they started ruining your furniture, and they gave your kid rabies, you'd want the skunks out of your house. you wouldn't say, well, we've always had skunks in the house, so what are we going to do? And we've kind of done that. We've kind of left the door open when it comes to tobacco. We have, local communities have attempted to take approaches where they just keep vaping products among, in stores that only sell to people who are 21 and older or 18 and older. It'll be 21 and older now. And what has happened is there's been a proliferation of additional tobacco shops throughout the store, throughout those communities. And so the pressure that it puts on is actually to find more outlets. And what we know through public health and addiction is that the more outlets you have to get an addictive product, the more opportunities and the more science that shows that it increases abuse and addiction. And so I'm at my point now, having worked on public policies and watched how public policies have changed behaviors in Minnesota, changed smoking in Minnesota, changed rates of addiction. We were on our way to having a generation that was not going to be addicted to nicotine. And because the back door was left open, we are now seeing our historic gains. When I started working in tobacco control and we said we wanted to reduce the rates of smoking and the way we wanted to reduce it, they said there's no way you're going to get those numbers. And we got those numbers and we exceeded those numbers in the state. And so public policy works. The back door's been left open and now we are losing our historic gains. And so that is why this is comprehensive, because we have tried for years to create to create exceptions and to be reasonable. And we can't be reasonable with a product that is addicting our children for life.
Representative Keel.
Thank you, Madam Chair. I'm going to pose something to you, whether it's internet sales or across the border. I know there's a perception that when we raised the taxes on, and I was a younger member then, and I watched this happen. Clearly, our tobacco products in my district decreased. I'd say a quarter of the countertop now, as opposed to what it was. However, a lot of people didn't quit. They just went across the river to North Dakota, where they got to purchase cheaper tobacco. It didn't stop them. And I don't believe this will stop people either from kids. Kids are traveling a lot, but not even kids, adults, and there just is a lot of movement. But there's also internet sales. So the question is, those are things that, of course, we can't control at the state level necessarily. Have you talked to any of the congressmen about what else, congresswomen, about what else they could be looking at rather than just opening this up for, making us an island rather than discussing it?
Representative Halverson.
Madam Chair and Representative Keel, again, really important issues. You're absolutely right that the federal government has a super important role when it comes to regulating tobacco. And we want the FDA to take on their role strongly and take some of these steps to do greater regulation. In absence of, decisive action by the FDA, we are looking to legislatures, we're looking to local governments, but now we're also looking to Congress, to your point. I have breaking news just this morning. The House of Representatives and the U.S. Congress passed the comprehensive flavor ban that we're looking at basically today in a bipartisan manner, 213 to 195. That is a decisive vote for the health of youth all over the country. And so you're right, this is being looked at all levels of government, and it needs to be. Regarding, you're also talking about another backdoor, and that is internet sales. We do have another bill to ban internet sales. And then the question posed about the black market or people going across borders, does that happen? Yes. Does that happen at a rate that erodes the gains that we make in the number of people who quit and the number of youth that don't stop? It actually doesn't. And because we've been working on this as a state for so very long, you know, when we passed the tobacco tax increase under Governor Pawlenty, when we passed Clean Indoor Air Act, we were looking at smoking rates for populations, you know, across the general population of about 25%. We are far below, we're far below 20 now. And so and we're historically low when it comes to youth. And so those kinds of reductions are real. Because they're from scientific surveys, they're from the Department of Health, and so we know that those reductions are real. So while there are anecdotal evidence of people border crossing and people not quitting, or I would say the anecdote of people going across the border to get their cigarette for a cheaper cigarette, it's the same when you talk about people switching from combustible tobacco to vaping. You're trading an addiction. It's not a quit. And so we have to do everything we can to make sure that people are not hampered by addiction. And the other thing that we've put in place, again, because of this historic tobacco lawsuit that we have in Minnesota, we have free quitting cessation products and counseling for everybody in the state. And so you can call 1-800-QUIT-NOW and quit nicotine addiction, or you can go to quitplan.com and get free resources to quit nicotine addiction. So I think that your point is really an important one, and that is it's not just a one-off approach. We have to do everything we can, because if we don't do everything we can, we get another nicotine epidemic in our state and our country, and that's what's happening.
Thank you, Madam Chair. It's time to go home, isn't it? I still have a 5-hour drive. It's okay. Gives me time to decompress. No, I just want to make one other comment. I still am concerned about the businesses. Granted, I know what they're selling and those types of things, but there's some real concerns about how these small businesses survive. But one thing I'd like everyone to think about, we talk about the advertising. I think we need to start teaching our children how to discern an ad, whether it's a vaping ad or a cereal ad or a political ad. It just drives me crazy as a farmer to go to the grocery store and see, this is non-GMO and they can sell it for that. Well, it never was. It isn't even, it just is funny when I look at it and I think, oh, we need to start teaching our kids how to discern the ad. What are they saying to you? What are they trying to tell you and convey? Do you want it? Should you want it? And I think this kind of is our problem in the end, is we're not teaching our kids to be discerning. Anyway, thank you.
Representative Freiberg.
No? I'll wait.
Representative Albright.
Thank you, Madam Chair. Representative Halverson, to the comment made about cessation programs and whatnot, I don't see anything in here of a notwithstanding clause that would prevent, let's say, a 17 or 8-year-old that recognizes that they need to get off of tobacco or nicotine. Would this language prohibit them from actually accessing cessation programs? Because you're delivering, even in a modified function, some amount of nicotine?
Representative Halverson.
Madam Chair and Representative Albright, no. Medical use of nicotine for cessation is excluded. And there are actually programs that exist, and perhaps my phone a friend can, Clearway, Minnesota, can mention what we actually have targeted quitting programs for youth, because I think to Representative Keel's point, the way kids are targeted are different, and so the way we target them to make sure they know that they can quit are different. So if I may.
To testify? Introduce yourself again for us. And
Thank you, Madam Chair and Representative Albright. Molly Moylan with Clearway, Minnesota. And with the youth e-cigarette epidemic, what has happened is there has been a gap in cessation, especially for youth and young adults. And last year, the Truth Initiative initiated a new campaign, text-based program, Ditched Jewel, the driver of the epidemic primarily. And it has been an evidence-based texting program that is working and helping youth and young adults take on this different type of nicotine addiction. So yes, we have cessation programs that have been, evidence-based, tried and true, but mostly based on cigarette use and, are more, the more traditional uses of tobacco products. But now we do have some newer tools available to youth, young adults who have come into nicotine addiction through e-cigarettes.
Representative Albright.
Thank you, Madam Chair. So just to clarify, the language in House File 3032 neither contradicts nor is in conflict with cessation protocols for minors.
That's correct.
Madam Chair and
Representative
Representative Albright, you are exactly correct.
Thank you, Madam Chair.
Okay, Chair Liebling.
Thank you, Madam Chair. Just briefly, I just want to thank you for your work on this. I just want to say that it seems to be coming up a lot lately in different contexts, the idea that in order to do something, we have to be able to fix everything. Public health doesn't work that way. There's always going to be there is always somewhat of a game of whack-a-mole. Some policies are more successful than others, but we just cannot say we're not going to do something because it doesn't fix an entire problem. I just want to call that out because if we were going to use that standard, we would hardly ever do anything. And we just cannot refrain from addressing some of these issues. There's just too much depends upon it. So thank you very much.
Thank you. Representative Fisher.
Thank you, Madam Chair, and to Representative Halverson, thank you for bringing the bill forward. I know that when my local community, the city of Maplewood, had looked at forward doing this several months ago, and I was at the city council hearing that they were doing this, and they were looking at moving forward with the ban and restricting things to adult-only stores. And one of the reasons they didn't take action that time, and this is what they instructed me, is let's get it done at the state level, because if they don't, then they'll come back and do it at their level. And what they're taking a look at is they knew this bill was moving forward, and they were hoping that we could get this done before the year is over. So I want to, first of all, offer that encouragement. And one of the things that have kind of come out is I hear a lot from the convenience stores and those small business saying that they're concerned about the loss of their sales. But the reality is for a very long time, they operated very successfully without those sales. It's been only more recently that those things have come into the market. And so I think in that area, as I do appreciate and I hear their concerns, I think that in reality is with everyone being treated fairly across the state, they're going to find that they'll just adjust their margins on other products and continue to succeed as they did before they had these products available.
Thank you. Representative Freiberg.
Thank you. Just to respond to Representative Fisher a bit, cities don't actually need to wait for the state to act, and I would actually say they shouldn't. I think they should continue to act and continue to put pressure on us. So city in my district, Golden Valley, went further than even what you were proposing because you talked about restricting it to adult-only stores. I think it's better to have a broad policy like this without that sort of exemption. I think this is really important for public health. I've never heard the analogy of it being like having skunks in your house before. But I guess that works as an analogy better as well as anything. This is I appreciate the importance of parents teaching kids about the importance of recognizing different types of advertisement, but this is an area where the deck is really stacked against parents. You have really appealing products. We saw examples of them in committee the other day with attractive flavors, and it's an addictive product. Nicotine is addictive. E-cigarettes and Juul were made to be as addictive as possible, and I've seen kids talking about just how overpowering their nicotine addiction becomes. So I don't think it should solely be up to parents to try to just fight these headwinds of mass marketing campaigns of addictive products. That's kind of the opposite of addiction is actually, I would say, the opposite of a free choice. It's not something you can control. So, and I think this is a really powerful way to counteract it. I think policies like Tobacco 21, which is now the law of the land federally, are great, and I'm glad it's moving forward here as well. But I think this is something that really has the potential to limit, to prevent kids from starting in the first place. The tobacco industry, you know, if you go back through the tobacco industry documents, it says they know that flavors are a way to attract kids. And, you know, whether you're talking about candy or fruit flavors or menthol, it makes the poison go down more smoothly. So I think this is a great bill. I'm glad that it's a comprehensive bill. I hope it'll keep moving forward. I'm glad cities and counties around the state are acting in this area as well. And thank you, Representative Halverson, for bringing it forward.
Okay, well, with that, and I'm going to just say I agree, and thank you for your bill, Representative Halverson. You know, I am really appalled at what is it, tobacco folks? It's Friday. Because not only have they targeted youth and children, it was intentional, right? They disguised it not only in flavor, but the vaping epidemic is real because they have really just target young people, along with creating clothing to help hide the vaping device. You know, and one of the things I think that we learned also from making exceptions was with the whole menthol and removing the menthol from our communities, right? But what happened with that exception is that we see shops, the gas stations that are popping up and putting a wall up, right? And say, oh, this is a different business. We're now a tobacco shop. That's what happened with the exception, right? And so we learn, hopefully we learn from that, and we're learning from that, that there is no exemption. Tobacco is killing our children. It's killing anyone who decides to, you know, for whatever reason to smoke. And I can say that because I was a smoker. I was a smoker because as a youth in my community, we were targeted. And it was like a really cool thing to do, to pick up a cigarette and smoke. And we know that addiction that starts as a youth can sometimes be a lifelong habit. And so I just want to thank you for bringing this bill forward and being so comprehensive in this bill. You know, we need it. We got to move forward. We got to save life. One, as a healthcare committee, we know the cost of healthcare and what's driving those factors, from heart disease, from, you know, cancer of the lungs, and we could just go on and on. So I just, again, thank you. Great discussion, you guys. Thank you for being here on a Friday. We did pretty good. It's about 16 minutes after 12. So with that, and there being no further discussion, the chair renews her motion that House File 3032 as amended be recommended for referral to the Committee on Commerce. All in favor say aye. Aye. All opposed? The motion prevailed, and House File 3032 as amended is recommended for referral to the Committee on Commerce. And with that, we are adjourned.